Good evening, TNT family. We are fortunate to have Dr. Lackram Bodoe, MP for Faizabad and Shadow Minister of Health, I believe, Dr. Bodoe. And we want to welcome you back to UNC USA. We deeply appreciate you taking this time out of your hectic schedule to join us and explain what is happening in the country with our healthcare system. And Dr. Bodoe, I want to welcome you to UNC USA. And something caught my attention recently with Dr. Tilak Singh bringing to our attention. There's some virus, very strong virus going around. We're not sure if it's COVID. It's causing intestinal problem. It's causing respiratory problems, and so due to the lack of proper medication and testing equipment, he's also cautioning people to restrain themselves from too much public association. So maybe you can give us a little enlightenment with that before we go in further into the program.
Sure. Thank you very much, Gary. And it's a pleasure again to be here to join you and your team and your listening and viewing public. The issue of healthcare, of course, remains high on the agenda throughout the world, and especially in Trinidad and Tobago. Survey by the UNC showed that the three issues that really are catching the attention of the population, and it is the economy, crime, and healthcare. I'm not sure if that's the order. Perhaps crime is at the top of the order right now, but the crime, economy, and the healthcare are the issues that are troubling citizens. Now, an interesting development that has been taking place throughout the world. At one time, what we call the communicable diseases had almost been eliminated. You remember the days of polio and typhoid fever and so on. And then we focused on what you call the NCDs, the non-communicable diseases. Those remain a big problem in Trinidad and Tobago. Now, with the appearance of COVID-19 and the pandemic in 2020, 21, 22 thereabouts, the world saw a different type of communicable diseases where viruses have now returned. So it is important for the population to be cautious. I had a quick read of Dr. Tiloxon's article. Of course, he's well respected in the field, and the advice he's given pertains to those. And again, I want to make the point that there is always going to be a vulnerable group of people, and from a public health education point of view, it's important to know that if you're immunocompromised, if you're a cancer patient on chemotherapy, if you're on steroids and that will compromise your immune system, if you're diabetic, if you have heart disease, lung disease, and so on, the virus that may not interfere or cause morbidity or mortality in a healthy individual can easily affect the elderly and those who are immunocompromised. So I just wanted to make that point generally. Now, in terms of whether this is a new emerging virus that can be as deadly as the COVID-19, I don't think there is sufficient evidence as yet. But I think Dr. Tilak Singh, in the interest of caution, is urging the public health measures. A simple thing like a common cold, if it gets out of hand in an immunocompromised patient, influenza and so on, can cause deaths. I agree that we have to step up the testing. I think this is what he's calling for. This is the public health labs and so on. We saw in the COVID-19 where the capacity and the ability and the capability to test took a long time, and therefore the results were taking long in coming. So the point here is that we should have learned from the COVID-19 epidemic, and hopefully our capacity and our sense of vigilance is enhanced to detect any new viruses as we go forward. So I just want to leave it there in terms of a broad introduction in artwork, and maybe we can talk a bit more if there are questions on this issue.
Okay, I deeply appreciate that. Now, Dr. Bodoe, what's your specialty? We never kind of really get into that. What's your background?
So my background, I have been a medical doctor for 2024 will make me 40 years. I graduated from the University of the West Indies in 1984. So it's really April this year I would have crossed 40 years as a medical practitioner. 34 of those years have been spent in the specialty of obstetrics and gynecology. So in terms of my specialty, obstetrics and gynecology would be my specialty. But I have an interest in public health as well. As you know, I was the chairman of the Southwest Regional Health Authority for 5 years during the period 2010 to 2015. So I do have a bit of administrative and governance experience in that role. But my specialty remains obstetrics and gynecology, treating pregnant women, treating women's diseases, really. But Gary, the point about it is when you practice for 40 years, you see a whole lot of things. You see almost everything, so you have a broad experience across the field.
Definitely. So you can give us a little enlightenment on what we saw transpired a few months ago with the neonatal fiasco there, and the amount of babies that was contaminated, basically, and died. And one of the things that concerned me very much, Dr. Bodoe, is the amount of cesarean deaths taking place, in our hospital, and I can't understand that. I mean, what kind of training these doctors had that this is happening? I mean, there has been too many. I mean, besides our entire health care system is a total disaster. Other than that, I mean, when you guys left the hospital, I mean, with the 5-year term, you didn't have much time to fix as much as you wanted, but you did a hell of a good job there. And this government came and capsized everything out of political prejudice. And they couldn't do anything better. They have done worse, we have seen in the last 9 years. And the whole system is a total disaster, far as I'm concerned, looking from the outside. I mean, you guys are physically there, and you're in the medical field, and you're seeing much more. But far as I can see from this distance, it is a total disaster.
So let me address. I think those are two very important points, because you see, the health of your mothers, the health of your babies is very important. Remember, though, that is the next generation that we are entrusted to deal with as doctors in the field. So let's deal with the issue of maternal deaths, women dying in pregnancy. Now, in 2010, when we entered government, what you call the maternal mortality rate, meaning the number of women who die in pregnancy, and it's calculated as a ratio. It's calculated number of deaths per 100,000 deliveries and so on, but it was pretty high. But the point I wanted to make is that we had inherited that, and in March of 2011, so remember the partnership came into government in 2010. And in March of 2011, there was a highly publicized death of a mother who died in childbirth at the San Fernando Hospital. Now, as a result of that, the then Prime Minister, Mrs. Prasad Bisesa, instituted an inquiry into the state of maternity and child health services. I would have chaired a committee to do that investigation. And I want to say that that committee comprised professionals across the board. It was across the political divide in terms of, it didn't matter whether you were UNC or PNM and so on. So it crossed that divide, it crossed geographical boundaries. We had 2 members from Tobago. We had an independent senator, former Senator Victor Wheeler, who is also an obstetrician and gynecologist. We had people from University of the West Indies. We had nurses, midwives, and so on. So the point about this is that this committee was very broad, and we did some investigations and so on. And as a result, certain recommendations were made, and that report was presented to the Minister of Health, then Minister Fuad Khan, for implementation. So that report was prepared and handed in 2013, and immediately some of these recommendations started to were being implemented. But of course, when we came out of government in 2015, we were not able to implement all of the recommendations. But we saw, based on what was being done, that there was some improvement already. Now, I mean, to be fair to this present government, I mean, they tried to maintain and sustain the gains and so on we made. But unfortunately, my information is that in the last year or two, things have started to be reversed, have gotten worse. I'm hearing reports of maternal deaths and so on at some of the nation's hospitals, higher than normal, in terms of some issues at Mount Hope and so on. I believe that is what you might be alluding to, Gary. So we have to pull this back in. It's a difficult situation. So that's as far as the mothers are concerned. What about the babies now? So the report also made some recommendations in terms of caring for what you call neonates and newborns. And the tragedy and disaster that happened at the NICU, which is the neonatal intensive care unit at the Port of Spain Hospital, that was a tremendous loss in terms of what was expected. So the facts of the matter really is that 9 babies died in a period of 4 days between April 4th and April 8th or 9th. So in a matter of about 4 or 5 days, 9 babies died. Now, don't get me wrong. There are situations where babies will die. Sometimes they might be very premature. Sometimes they might be delivered or born with abnormalities and so on, not compatible with life. So there is always what you call a neonatal mortality rate, where you can have deaths and so on. That is expected. The problem, though, in this situation is that this tragic event was caused by an infection, and it would appear from the PAHO report. You remember that, Gary, the Ministry of Health, the Minister of Health and the government asked PAHO to send a team to do an investigation. And some of the findings of that investigations were very, very, very frightening and worrisome, because it showed that there was a breakdown in some very basic issues with regards to hygiene. It showed, for example, that hand washing was not regularly practiced, and there was a lot of breach in terms of the protocol for dealing with the little ones. And I think that is the tragedy. So the mothers, the parents, are left to wonder whether those deaths could have been preventable. I don't want to say too much more, because I know that some of these matters are before the court, or going to be before the court very soon. I don't think that any matter has been filed as yet, and I'm sure that that will come back in the limelight when the matter reaches the court. So I think, the preparation for baby over a 9-month period for parents, they look forward to this with, a lot of joy, preparation. Not only the parents, Gary, the grandparents, the family and so on. The birth of a baby is a big, big thing. And therefore, as doctors, as administrators and so on, we have a responsibility to ensure we do everything possible to prevent these kind of deaths. And I think that tragedy at the NICU in Port of Spain, General, in April, stands out as one of the worst indictments on this government and on this Minister of Health. I am still not certain, to be honest with you, whether the recommendations made by the PAHO team have been implemented, whether all of them have been implemented, and we worry about that. Before I close on that issue, I just want to say, and you asked me about my training as a doctor, and the reason I know so much about this is that during my training, I actually spent 15 months in the NICU at the Mount Hope Women's Hospital in 1988, 89, thereabouts. And at that time, it was a new hospital and so on. So I know what kind of care is required to treat with these little ones, to ensure that they pull through, that they survive. Infection is one of the greatest killers in that environment. And it appears in this instance that the whole infection prevention control protocol had broken down, under the watch of those in charge. So that was a tragedy, and it's a reflection of what is happening in the health system in other areas.
But could that have been prevented if these kids were treated at the Children's Hospital with the amount of equipment and resources that was placed there? Could that have been much more prevented, being that if that was existing in that location instead of where the kids were?
So you're raising a good point. So you always have the need. There's always a need for what you call beds in the neonatal intensive care unit. Sick babies will always require, a NICU to have the best chance of survival. So the irony of it is that that while this tragedy was happening at Port of Spain, you had Couva Hospital, as you know, shut down. It was used temporarily for COVID by the government and then promptly shut down. So the answer is, to some extent, yes, that the equipment was there, the facility was there. You know, Couva Hospital is unique. It's the only hospital in the Caribbean that has a separate emergency entrance for children. So you have what is called the adult emergency and you have the pediatric emergency. Why is that important? It's important because in the other hospitals, when you go, children and adults go through the same entrance. Now, while there is a system in place to do what is called a triage, where children are supposed to be given priority and so on, that doesn't always happen. There are scenes in this country where you have little ones waiting outside for long hours and so on. So the thinking by the then Prime Minister was, listen, let us design a hospital where you have separate entrance for children and separate entrance for adults. So that in itself would have shortened the waiting time and made access for children easier. But yes, there was at the Couva Hospital, there were the facilities, there was the equipment for both what you call a NICU, neonatal intensive care unit, and also what is called a pediatric intensive care unit, a PICU as well. But sadly, that is yet to be utilized, and many are suffering because of the failure of this government to fully open the Couva Hospital. And some might even want to think that this is political sabotage, this is political spite. But the population will have to judge the actions of this government, and hopefully the time will be soon.
Hopefully they make the right decision. But what I would like to see added to that hospital is a labor and delivery wing there, so that we have the children hospital and we add that wing for the labor and delivery. So now you got the mother and the baby care in one location. So I think that would be an excellent idea to see in Central, where we add that section of the hospital there for women that are pregnant.
Well, again, besides that, I mean, look, you're looking at 230 beds. I mean, the population needs to be reminded that hospital has 230 beds. And really and truly, if there wasn't a hospital in Central. You had Port of Spain, you had Eric Williams and Mount Hope, and then you had San Fernando. So there was a big gap in Central, and that is the reason why the Couva Hospital is constructed. So the people of Central, instead of having to travel to South and Port of Spain and East, would have easier access to the hospital. Now, because that facility has not been opened, patients who go to the Couva District Health Facility have to be transferred to San Fernando Hospital. They need to be admitted, or sometimes to Mount Hope. So can you imagine the tragedy, the irony of you sitting or lying in an ambulance? You've been sent from Couva District Health Facility to get a bed at San Fernando, and you're in the ambulance and you're passing by, speeding with sirens and all of this, Gary, and you're passing by a brand new facility on the highway that you can't access because the government decided they don't want to open it, and then you end up in San Fernando where you have to wait on the corridor for a bed. How tragic is that? That in itself is a great tragedy.
Well, I think it's more tragic, especially with the highway that they cannot finish. They cannot finish right now. It seems to be a simple a few more kilometers that they cannot finish. So you could imagine that the stress that is causing for an emergency in transit, where ambulance is in the rush to get somebody that's is in danger and needs help urgently, bypassing the Couva Hospital and has to go San Fernando, Port of Spain, in the rush of that traffic. This government has cost us, and as far as I'm concerned, this government is a threat to our lives in many ways than one.
No, it's interesting. You're making a very good point there, Gary. I mean, and this government seems to be incapable of finishing any project. I mean, if we just go back to the health sector a little bit now, the population, the country had been promised the Point Fortin Hospital for a long time, since the 1960s. It never happened. Then Prime Minister Mrs. Prasad decided, listen, we have to get the Point Fortin Hospital built. And before we demitted office, the SUD was turned for that hospital in July of 2015. So it was there, everything was in place, the user brief and so on. It took them 5 years to complete that hospital in 2020. And then it took them another year or two to fully operationalize. In fact, that hospital is still not fully functional as far as I understand. So even And the same thing with AREMA. But the point we're making is, yes, this is just a few kilometers of road, and yet they are unable to complete that properly, and it's creating tremendous burden and hardship, for citizens on a daily basis. And yes, if you have an emergency and you get stuck, I mean, so that in itself is a tragedy. They boast. There's a big boast about the highway from San Fernando to Point 14. Do you know that when you reach the creek, you still have to travel, and you have to travel very carefully on a, so it becomes a highway now, becomes a single lane, and
Into a trace or a back road.
yeah, but you know what is worse? There is no shoulder. So if a vehicle breaks down on that piece of the road, then it creates a tremendous amount of backlog and so on. So it's a great inconvenience. So this boasts about
Is that kind of falling into your constituency a little bit? Is it
yeah, yeah,
within?
yeah. It falls. It falls. It's the entrance to my constituency, but it is also the entrance to the constituencies of Labrie and Point 14. So it shows that this government not only doesn't care about opposition constituencies, but they don't even care about their own constituents who have to traverse this road on a daily basis to get to their homes and their businesses and so on in Labrie and Point 14. So that tells you something. That tells you something.
Well, we know we recently saw an incident where MP Lisa Morris Julian was consumed in a fire, and we are all anxiously waiting a report on this from what took place on the fire from the fire service end of things. And I mean, the cause of the fire we will need to find out eventually. But I am just kind of concerned that I think totally here, and also that fire station was about 2 minutes from her house.
Well,
So
Gary, first of all, I mean, I would again want to, express my deepest condolences to the family, loved ones, and so on, and the whole community of MP, deceased MP Lisa Morris Julian. Now, I knew, of course, in the parliament, and we served on the same joint select committee. Um, so I know her, and it's a great tragedy. But I see that the Prime Minister has called for some sort of investigation. And the leader of the opposition this evening, when interviewed by the media, actually called for a criminal investigation because it is now emerging from the technocrats in the Trinidad and Tobago Fire Service, who are saying that there are many fire stations that are without fire tenders. Now, how ironic that you could have a fire station and you don't have a fire truck, as we call it. I mean, what is going on in the country? You understand? And if it is that tragedy occurred and there was a fire station, just a few minutes away, then I think an investigation is necessary to find out what happened and whether it was preventable. But I want to leave that there for now, and I really hope that we can get to the bottom of this. Not only so the family, it will bring some closer to the family, but for others, in other areas throughout the country. Fires, I mean, it can strike anybody at any time. And one of the responsibilities of the state is to ensure that you have security, not only from crime, with the police service and so on, but also the fire services.
yeah, the emergency response, resource is a very high concern, especially where we basically have an ambulance with an oxygen tank and lights and no real equipment inside there with no training, and it's a lot to be concerned about. So these are the things that we are hoping our UNC government can put in place.
And Gary, there's a lot to be fixed. There's a lot to be fixed. I am of the opinion that this government has reached a point after 9 years where, we'll be waiting in vain. It will be a futile waiting that they are capable or willing to fix anything. So I think that, I think the population is just waiting to exhale now, to have some new blood at the helm so that a lot of these things can be fixed. The response time for ambulances sometimes, is questionable. So that issue needs to be dealt with and so on, as well as many other issues in the health sector. There's a whole, there's a whole lot we can talk about. Every day you have citizens complaining about different aspects of care. The issue of waiting long periods of time for surgeries, shortage of medication, those remain big issues. Another worrisome thing with regards to the health sector is the lack of maintenance in new buildings. Now, we spoke about the Vancouver Hospital not being open, but worse is the fact that the San Fernando Teaching Hospital, which was opened in 2014 by the partnership government, and again added 230 beds to the system, that hospital is not being maintained. From what I understand, I'm told that there are issues with things like washrooms and the lifts and so on. Even external part of the building panels have fallen off, and there's no there's no regard in terms of maintenance. You know that if you buy a new vehicle and you don't maintain it within a matter of short time, it will become a wreck. So if we invest billions of dollars in the health infrastructure and we don't maintain it, and we don't have a proper plan for maintenance, then we're going to run into a big problem. So that is also an issue. Um, there's also the issue, of course, of the the long waiting times, the shortage of staff, and again, this challenge of so many young doctors coming out of medical school, finishing their internship, and they can't get jobs. This government has done very little to address that. But I give you the assurance that when this government is changed, that we form the government, that we will address, the many of these issues that we will address.
I would like to, if possible, if we can arrange for a forum with a lot of these doctors in the waiting and have a kind of a discussion with them so that the public can see what resources they have waiting to assist them, and then they are not being assigned, allocated where, because this is a life-threatening thing. Lives are being lost because we have trained people, none of we don't have it, and it's not being utilized because of whatever political reason, lack of concern of citizens. And we are seeing that with this government. So these are some of the things that I want to see that going forward. This channel, there's a lot available that, and it's always available for usage for you or any of our MPs that you want to bring any issues forward. So I just wanted to kind of reiterate that. You had, I know you were involved in some of the cath lab issues and heart surgery and stuff like that. Can you enlighten us a little bit more on that?
Yeah, well, I know that you have my colleague, Senator Lyder, would have a lot to say, I'm sure, on the issue of national security, economy, and so on. So I don't want to waste time. So I will just close on that point of the cath lab, and I want to put it again in perspective. Now, this cath lab it stands for cardiac catheterization. So what is that? So when you get a chest pain and you go to a hospital, the most important thing that needs to be excluded is whether you've had a heart attack or not, and whether you have blocked arteries. Now, the gold standard for doing that, the blood tests and so on you can do, but the gold standard is to actually put a dye into your vein and let it run to your heart and take a picture. So that's called an angiogram. It's called a coronary angiogram because the vessels that supply the heart are called coronary arteries. So when you do an angiogram, you can see, okay, listen, this artery is blocked, that artery is blocked. And the mainstay of saving a patient's life at that point is to put something called a stent to bypass the block and allow the blood to flow again. So this is the purpose of a cardiac catheterization lab. We call it a cath lab. San Fernando Hospital doesn't have one. The Southwest Regional Health Authority serves 600,000 people, almost half of the population of Trinidad and Tobago. In 2014, one of the priorities of the partnership government, we recognized this early, and we put things in place to build a cath lab. And the tenders went out we identified a space, tenders went out 2014 and so on. We were on the verge of awarding the contract when the government changed. And so 9 years, going into 10 years later, this new government is yet unable, despite having the benefit of a space, the benefit of, well, I mean, they did their own thing. They sent back all the tenders and so on. That's fine. They retender. That's okay. But why is it taking so long to put this in place for the people of the Southland? You know, some patient remarked to me that this is almost a kind of geographical discrimination. You know, there's that talk when it comes to flooding and so on. But in terms of healthcare, it's unfortunate. Now, the government will respond and say, okay, well, they don't have a cath lab in San Fernando. They have, the ministry pays for the procedures, angiograms, and stenting and so on. But the question is, how long does it take to wait, to go on the ministry's waiting list to get the procedure done? And I can tell you, even from my own constituency, several of my constituents over the last 9 years have unfortunately passed away from their blocked arteries while they're waiting on the government um, to pay for it. So one of the policy manifesto promises that was made on the platform by the leader of the opposition is that as soon as we get back into power, we are going to ensure that that cath lab is constructed and operationalized at the San Fernando Hospital to bring relief to those heart patients. Heart disease is one of the major killers in Trinidad and Tobago. You know, it's if not number one, number two in the list after diabetes. So we want to give the population the assurance that we will treat with that, you know, in a very serious and urgent and deliberate matter.
Arjun,
Gary, can I ask a
go
question,
ahead,
Gary?
Arjun. Go ahead, Arjun.
Yeah,
Go ahead.
sure. Good night, Dr. Bodoe. This is Arjun Haripol. I just wanted to get you to elaborate a little bit more on what you just started there, because I know some of it was covered in the budget debate recently, but I want you to speak a little bit more to the immediate priorities of a UNC government in the area of healthcare. Of course, I know Cuba Hospital would be high on that list,
Yeah.
and the care for the elderly and so on, some of those recent policies. But could you just speak briefly?
Yeah, certainly. And I believe that the leader of the opposition, soon to be prime minister, would be in the process of maybe preparing what we would call a 90-day or 100-day action plan for all of the sectors, including the health sector, the things we would want to achieve and the ones that we would want to prioritize first. So the cath lab would be high on the priority list. The full operationalization of the Cuba Hospital would be high on the list. The expansion of the Children's Life Fund. As you know, the Children's Life Fund came about in 2010 to allow those children who could not have surgery in Trinidad and required surgery abroad to have it. So that needs to be expanded. That will be high on the priority list. One of the other issues we have in Trinidad, besides diabetes and heart disease, is the issue of hypertension and strokes. Now, patients who get a stroke, sometimes if they are treated quickly and they are rehabilitated properly, they can be expected to resume some sort of normalcy in their lives. So one of our intentions is to construct what we call a stroke rehabilitation center, so provide specialist care for these patients. The waiting list for not only clinic appointments, but for surgeries, especially eye surgery, and joint replacements and so on, is too long, and we intend to address that, in a very definitive manner. There are many other issues in the health sector. Of course, the issue of treating with the NCDs, the long waiting times that patients experience in the clinics. We have the doctors waiting for employment, so we're going to fix that, put that in place. And of course, there's always the issue of the shortage of drugs in the CDAP program. Our intention is to review the CDAP program so that we can expand the number of drugs that become available, and also to update the drugs. Many of the drugs that are being currently used for hypertension and diabetes in the private sector are not available on CDAP, so we want to address that. And last but not least is the issue of cancer care. In terms of the facilities, we have that. Our intention is to, again, address some sort of national oncology center. The evidence is that if you treat a condition in one place or by one specialist, then you become good at it, as opposed to the treatment being all over. And last but not least would be the issue of addressing mental health in the population. It's a big issue. It has been there, and especially post-COVID, it's an issue that needs to be addressed. So those, quickly and briefly, would be some of our priorities as we go forward. As I say, there are many others that we need to deal with.
So,
I would want to
so
leave it there.
I believe there's also the dialysis centers because right now dialysis is third party, correct?
Very good issue. In fact, this government. You have to laugh if it wasn't so sad. 2 years ago, in the budget, the Minister of Finance announced that they are going to build a national renal center at the Cuba Hospital. So we were looking to that. Then the next year in the budget, that item completely disappeared. The intention was really to centralize the care of renal dialysis and so on. And as you mentioned, renal dialysis, Gary, there's the issue of transplantation. Now, patients who have kidney failure, dialysis is really just a temporary solution for some of them, but many of them can be cured if they get a kidney transplant. And what has been happening now in the country is that some patients, even when they get a donor, they are unable to get the transplant done in the public sector. There are issues apparently at what you call the National Organ Transplantation Unit, NO2, which is based in Mount Hope. And again, that is something that we are going to address and fix.
Dr. Bodo, can you also speak a little bit to any policy that the incoming UNC government might have to deal with these backlog of cases for simple things like cataract, for example? There is a huge backlog in many of the hospitals and other major surgeries. How you plan to deal with the backlog? Is there going to be some kind of policy to clear that backlog in a short space of time?
Yeah, well, the short answer to that is that the overriding policy will be to have what we are going to call a guaranteed maximum waiting time. So in other words, we are going to set a standard and say, listen, you need to have a cataract done. The maximum time you should wait for that should be 3 months. I'm just giving an example. It may be less, it could be more. But the point about it is that the patient now is given a certain guarantee by the health system. So if that means that you have to do cataract lists on a weekend, on a Saturday, if it means you have to bring out more doctors, if it means engaging the private sector where feasible, on a reasonable basis with proper arrangements and so on. So the point about it is that once you set your standard and you have the timeline and you have the time frame, then it has to be done. So I don't want to speak to any particular measure that will be taken, but I can say that is what we are going to do. We are going to guarantee the maximum. The same will hold for clinics in terms of seeing a specialist and so on. So that would be the policy framework, and then we'll build on the details as we go forward. For each particular surgery, it will be different. Cataracts, hip surgery, cardiac surgery, and so on. But that's a very important point, and the population, needs to be given that assurance. Because, I want to close on the point because I know Senator Lyder is probably having on hold and so on.
Well, you could use as much time as you want. He's not ready yet. So
all right.
If you could spare us any time, feel
sure.
free to say what you have to.
So this government, there's a strategy by this government. Every time the Minister of Health comes and speaks in the Parliament, especially at budget time, where they come? They come and they talk about numbers. They talk about they've done 1,000 lab tests, they've done 2,000 this and 3,000 that. What they don't do is put those numbers in perspective. So, okay, so you've done 1,000 lab tests, but you don't tell us how many lab tests were requested. If it is that 3,000 lab tests were requested in that year, or that month, or 3 months, and you did 1,000, then it means that you have a gap of 2,000. So that is a strategy that they use to tell you that, listen, we're doing a whole lot. But doing a whole lot in the context of the need, and that is what we don't know. There's also the issue of healthcare is free to the population, and therefore we should be grateful. You know how it operates. Nothing is free. Taxpayers' dollars are being spent for healthcare. It might be free at the point of delivery, right? But the point about it is that even if you're getting free healthcare and it is not timely, then it doesn't matter. So if you're getting your bypass or your stenting for free, and you have to wait 6 months or a year, and you die in the process, then what's the point? So it is not only about it's about timely healthcare as well, and that is why we are going to put limits in terms of how long you would be expected
Lily, you have any question that you wanted to ask Dr. Bodoe? Lily? Okay, Arjun, you can continue with whatever question you have, Trini.
On a lighter note, just to go back to that issue of the dangerous levels of that we're seeing in terms of mental health in this country. I think if you remove the PNM part, that problem is partly solved.
No, it's no. Well, I'll tell you something. We might be laughing at this, but you're making a point. Now, you see, when you face difficult economic situation, when you face the threat of crime, when you go to bed and you have to lock up left, right, and center, and you're still not sure that some bandit will not get into your home, and you can't defend yourself, and you could go into a whole new discussion as to why you can't defend yourself, because you can't get something to defend yourself and so on. That in itself creates stress, and stress can lead to mental health issues. So you're right. The fact that the present government has been unable to address crime, has been unable to provide jobs and so on, creates a lot of mental health. We all know that as a breadwinner, if you can't provide for your family, it becomes very stressful. So yes, you're correct about that.
No, it's no joking matter. I mean, it's a fact of life. When people are stressed out and the quality of life in Trinidad and Tobago at this time, we've been bombarded on all sides, economic front, in terms of our personal security, and the list goes on and on and on. That definitely affects the quality of life. And once you feel unsafe and the quality of your life has gone down, people react, and you've seen it. I mean, last night a man just went and stabbed up a man because he was packed up in front of his house. Short fuses, and we say, what went through his head? But the problem is, we don't know. That was the straw that broke the camel's back. But what stress this man is under, we don't know.
Yeah. So there's a lot of stress and a lot of mental health issues in this society. And, so there's been bandied about a national mental health plan, but that is yet to be seen. But we intend to address this issue very seriously. COVID highlighted a lot of the issues, as you know, because people were forced to be isolated and from the communities and so on, and were together in closed spaces for a long time. And many of the issues that were under the carpet, came out into the open. So yes, mental health is a big issue.
Well, we definitely saw it in the classrooms in the school. When those children were let back into the classrooms, you saw the surge in bad behavior in the classroom. So clearly that was a reflection of what you're speaking about.
So it's a good point you're raising there. Is it Arjun I'm speaking with, right?
Yes.
Yeah, so that's a very good point, and it reminds me that one of the policy measures that we are going to put into place is to make sure that doctors are available to all the schools, not necessarily located in each school, but the services of doctors and psychologists and so on will be available, not only to pick up the physical ailments and so on, but also to look at the mental health issues. So that will be one of our policy measures. I'm on the tail end of a virus here, which I think is making me cough. So I don't know if my colleague is ready to come on at this point.
No, he's not ready yet. I will see him. He was supposed to come in an hour after you, so you do have time anyway.
Yeah.
But the issues if you can spare us the time, you want to grab some water, Doc, or you?
Yeah, let me grab some water if you can excuse
Yeah.
me for
So
water.
guys, we could chat in the meantime while Doc grab some water. You have it accessible?
Yeah.
So we could raise any issues that we want to at this point. Go ahead. Lily, are you there?
Sorry. Hi, good night. I was having some technical issue here. But I would like to find out what is in the pipeline for primary care, like the health centers, the community, if there's going to be any extended hours, because most health centers are open 8 to 4. This is the time where a lot of people in the community are at work,
Lily, as you would recall, that's a very, very good point, and thank you for raising that. Now, as you would remember, in the period 2010 to 2015, our government tackled primary care frontally because we recognize the same thing, that 8 to 4 is when people are working.
Yeah.
They're not going to give up their job or leave their job to come and have their blood pressure and their sugar checked. And that is the reason we introduced extended health centers at some 45 plus health centers throughout the country. There are 103 health centers in Trinidad and Tobago. So we did two things. We refurbished those health centers, made sure they were up to date and so on. They did the infrastructure work, paint up and so on, make sure that they were up to standard. And we also extended the hours, in some cases up to 8 o'clock, in some cases up to 10 o'clock. We also looked at the issue of remote areas. For example, in Carcass, if you get sick in Carcass, it's a long journey to get to Point 14, and then from Point 14 you have to get to San Fernando. So we opened extended hours in Point 14, and I believe somewhere up in the east as well, in the Toko area and so on. So yes, our policy, but of course this government didn't think that was a wise idea, and they stopped it. So we intend to reopen and extend the hours, not only on evenings during the week, but to open on a Saturday and in some cases Sunday as well, because the burden of NCDs in Trinidad and Tobago is very high. The Simangal report discovered that there was a big backlog of NCDs and so on in Trinidad. Now, I just want to address something here. You know, I don't know if you all recall this boast about a parallel healthcare system during COVID. You all remember that?
Yeah.
Clearly. Go ahead.
Minister of Health came about and was boasting about this parallel healthcare system, saying that we were unique in all of the countries in terms because we were able to carry on normal treatment in the hospitals, and we had these COVID hospitals, right? Cuba, of course, all of a sudden after 5 years, within 2 weeks, it was able to they were able to operationalize it. Yeah, so a hospital, which all of the time was a construction site, within 2 weeks became fully functional to treat COVID patients. But the point I'm making is that this parallel healthcare system was a total hoax. It never happened because what they did, they took the same doctors, the same anesthetists, the same doctors from the normal hospitals and sent them to the so-called COVID hospitals. And what happened is that there remained a backlog, and the backlog increased. So patients with diabetes, high blood pressure, heart disease, and so on, their appointments were pushed back, their disease got worse. And therefore, post-COVID now, we are facing a bigger burden. So that is something we need to address. One of the issues in the health center, Lily, in terms of primary care, is that the clinics have large numbers of patients. Sometimes you have 100, 120 patients who have to be seen in the clinic. And the number of doctors to deal with these patients is not sufficient. And therefore, our intention is to try and increase the number of primary care doctors for two reasons. One is to reduce the waiting time that patients have to wait for care. Another, so that the doctors can spend a little bit more time with the patient to counsel them. A lot of times you have the doctors, because they have so many patients and so few doctors, all they can do is repeat a prescription, write a prescription. So yes, that is something we're definitely going to treat on a very serious basis.
As far as I'm concerned, if I may jump in here for a minute, our health centers should have an emergency section that is open 24 hours because of the nature of the situation that we are experiencing in the country with not so normal things, people getting shot, stabbed, not the basic healthcare issue. I mean, so I would definitely say that we have to have a few of these health centers, being directly available, to our citizens.
We do have some of these facilities in the SIPAR. So we have what is called district health facilities. So in Sipari, you have the Sipari District Health Facility, which was open 24/7 in 2010, 2011. That remains open. Princess Sound, you have the Princess Sound District Health Facility in Couva, you have the Couva District Health Facilities, and other areas of the country. So those are like satellite centers that, you know.
So they remain 24 hours? Okay, that's
They
good
remain,
to know.
they remain 24 hours, you know, 48, and then but it will not be feasible. It will not be feasible to open all the health centers 24/7. But certainly the extended hours up to 10 o'clock will take care of minor issues, you know, cuts, bruises, and so on. But
Right.
yeah, so we intend to address that.
Doc, coming back to the hospitals, the Point 14 Hospital and the Arima Hospital, and I believe this the hospital that the second hospital that they built in Tobago,
Mm-hmm.
and even the Scarborough Hospital, they are not technically real hospitals because they don't carry out surgeries and so on. Am I correct in that?
Yeah, well,
They're glorified health
yeah,
centers.
certainly. So the population needs to be reminded that the first hospital that the partnership completed or built was the Scarborough Hospital in 2011. We tend to forget that. That hospital had lain in a state of, you know, construction for a long time. So one of the first measures we took was to actually finish the Scarborough Hospital. To some extent, it cannot do all the services in terms, for example, we come back to the issue of treating heart disease and the cath lab. Now, there was a cardiac catheterization lab put into that hospital when we did it in 2011, 2012. Unfortunately, in 2016, I understand that that facility was no longer functional, and patients have to be transported from Scarborough to Mount Hope and so on for that kind of treatment. So you're right; it doesn't offer full services. The second hospital you're talking about is the Roxborough Hospital, which I believe is open more as a as a health center.
A
I'm not,
glorified health center.
yeah, some would say that, the I think there's still some work that needs to be done in terms of getting it fully functional. So you're right that needs to be addressed. For
The Point 14 Hospital and the Arima
now the,
Hospital.
now the Point Fortin Hospital, um, the services are being rolled out, on a phase basis. But to be quite honest, I mean, you have a hospital, which was opened in 2020. This is 4 years. I mean, it's taking too long to have it fully operationalized. I also understand there are issues at the Arima Hospital. I'm told that although you have staff assigned to the Arima Hospital, many times and many patients are sent, not treated at the Arima Hospital, and sent to the Mount Hope Hospital. And the question is, why is that the case? I also understand that some of the staff that were employed at the Eric Williams Medical Sciences Complex under the NCRHE, this staff are assigned to the Couva Hospital, and we know that very little is happening at the Couva Hospital, that benefits patients. So there are many issues that need to be addressed as to why these hospitals are not fully functional. But I give you the assurance that, when we form the next government, that these are things that we are going to look into and deal with, in a very definitive and, deliberate manner.
So Lily, you have any more questions or Arjun?
Yes, I just want to make an input. Um, at the primary care, it is so unfortunate that when you visit there, they don't even have a CBC machine available at some of the health centers. You have to go see the doctor, then the doctor have to refer you to go get a CBC done, and then you have to go back to the health center to get it read and reviewed, right? And that is so poor, right? I think all of these things, there needs to be some upward, mobility here. We need to have some, technology. Like you need an CBC machines to say the least at each health center. A patient shouldn't have to be, you're sick and you have to rush to go get your CBC done and then rush back to the health center to get reviewed by the doctor. That is causing more pain and frustration on the patient's part.
Lily, I think you're raising a very valid and very important point, and that is something that we will address. Each health center should at least be able to do a basic investigation.
Yes.
Or even if you have, let me say, cluster, if it's not each health center, let me say you have 3 health centers in one close by, one area, at least one of the health centers should have the facility. You're quite right. You can't take the patient's blood, and many times this happens. Patients go, they have blood tests done, and they by the time they come back, they still can't get the results. Sometimes they get worse. And the irony is, even, and let's take it further, even let's say for ultrasound scans for pregnant women, for example. Sometimes they go and for an appointment, and we spoke about waiting times for surgeries and so on. But what about the waiting times for investigations, ultrasound, scan, MRIs, and so on? You know where's the joke in this place? In the antenatal clinics, sometimes the patients get an appointment to do an ultrasound scan to check the status and well-being and health of the baby. And sometimes they get the date. The date is so far that by the time the date comes up, the baby born already. So you understand. So it really is a system that needs to be revamped,
Yes.
and worked in a much better way. A lot of the time, so it's not only not being able to do the blood test in the health center, but also when they take the blood and they send it to wherever, San Fernando, it takes a long time to get results. And again, we come back to the issue of timely treatment. To treat a patient on a timely basis, you must have results quickly within, as you know, a short time. Otherwise, there's no point getting a result, 2 weeks after, and you can't work on it. It's too late. So I agree with you. We need to introduce more technology. What's very interesting in telemedicine is a big thing now, right? I was invited to a conference in Guyana in July of this year. Now, Guyana is a big place. It's very progressive. They are building 9 hospitals in Guyana. The president, of course, is trying to expand it and provide proper healthcare for the citizens of Guyana. So what they do, because they have remote places, they use the technology a whole lot. So you have the technology where a nurse or a doctor in a remote area can send an image, to a central station and get reports and so on. So I believe that is also what you're alluding to. That if it's a long distance away, that we can use the technology and so on to make a quicker diagnosis. And I think that is something that we'll be looking at as well. The other issue that we want to look at is in terms of how to address this backlog with CT scans, ultrasound, MRI. There are two things on the table. One would be what you call standalone diagnostic centers, where you just do those tests rather than go in the hospital and you have to wait. The other issue is whether it might be feasible to have, a mobile unit go out to different areas to perform these investigations. So that's something that we will look at as well. It's done in some big countries where you have remote areas. It's all about bringing care to the patient. It's all about making the care convenient and accessible for citizens.
Thank you.
So any more questions, guy? Senator Damian will join us in about 15 minutes. So we have about 15 minutes. If Dr. spares any extra time, you guys have any additional questions? So, okay,
Thanks,
I guess.
thanks, Doc, for being here with us. And I want to. It's similar to what Gary was saying at the beginning and what Arjun was saying. We need to get that message out to the population about what our plan, what we have in store to continue, because when the PP government was in place, they had a plan with the digitization of records and so on, so that good patient care and we'd have effective management of our health care, which left with the PNM for the last 9 years went to a total mess. So we have to get that message across to the population and let them know all that we have discussed here and what are the plans that the UNC have going forward, because the population wants to know what are they getting from they don't want exchange. They want to know what the UNC is bringing forward. So we have to start elaborating on those things, and
No, I agree. We've done it before and we'll do it again. Healthcare remains very high on the agenda of the incoming UNC government. We understand that healthcare is important to every citizen, regardless of who you support, which party you support. That doesn't matter when you get sick. I mean, we all want to be able to access proper healthcare. WHO would say that health is a right, and indeed it's in many countries in the world it's regarded as a human right, and therefore we have to treat it in a serious manner. So we understand what is happening. We understand that the health sector, has virtually collapsed under this government, despite the many they would have tried to have you believe otherwise. And we have the plans and policies in place, and we'll continue to roll those out. The leader of the opposition would roll those out as we go forward in our meetings in the new year.
I want us to be able to, if we can, utilize this platform where, like I mentioned before, that you bring people, medical professionals in the waiting together with the professionals like yourself and Dr. Gopi Singh and the other doctors, to kind of lay out a plan of action, showing the population what we're going to do, letting the young people know that there is, an opportunity for them in the country, and they don't have to look elsewhere. That your government is creating a platform for that, and we could get a discussion going. I can do a few series, as your availability is going forward, so you could speak to those that you wish to bring on, and we can set up something. But we do an ongoing series and create that platform because the more we reiterate things to the population, is the better they will understand. Because sometimes, with people, you have to kind of say it more than once, basically, and I want to kind of create an educational platform here going forward. So the channel is always available to you. So any other questions, guys? Doc, you wanted to say something else?
Gary?
Lily, go ahead.
Yes, thank you. Since COVID, we have seen a lot of medical staff just leaving the country in droves. What is your take on that, Doc? What do you have to say about that? Because right now the hospitals are very short-staffed. Medical staff is short-staffed. They're overworked. They're overwhelmed. They are underpaid, right? They are treated very poorly, and yet we are hearing, nurses and doctors are at the top. Healthcare is at the top of their agenda. What is taking place with that?
It's a very real issue. The issue of nurses, especially as we know throughout the world, there's a shortage of nurses, and therefore it is the responsibility of a government, in our country especially, to take every reasonable measure to try to retain our nurses. So we would definitely want to review the terms and conditions by which nurses and other healthcare workers currently provide service, and certainly have some sort of discussion in terms of what sort of incentives and so on might encourage our healthcare staff to remain. Our healthcare staff remain the backbone of the health sector, very important. A lot of our doctors are leaving as well because we, for some reason, are not providing the opportunities for them to be able to provide service locally. So that is a matter that we have to address in a very serious way. Guys, I want to, if I may, take my leave at this point. As I mentioned, I'm on the tail end of the virus here, and
okay, yeah. Thank you very much. We will
there's a lot
discussion with you.
Yeah, a lot to discuss there. The health sector is definitely something that we keep on the front burner. As we go forward, Gary, I thank you for the invitation to continue to be on the platform.
We appreciate that.
And early in the new year, perhaps we try to roll out some of the plans and policies and so on. So before I go on, let me just take the opportunity to wish you and your viewers and listeners all the best for a very safe and holy festive season and a bright and prosperous 2025. I certainly hope that 2025 will be a better year than this year we've seen so far. So may God continue to bless all of us. Thank you very much.
Thank you
Thank
very
you,
much, Doc.
Thank you, Doctor.
Take care of yourself.
Thank
So,
you.
guys, we want to continue conversation because we are waiting on Senator Lyder. So, if there's anything national security relating, I mean, your safety and stuff like that, you can, we can discuss it with him, or you want to raise any matters in the meantime, you can continue discussion while we wait on Senator Lyder. Dr. Bodoe, thank you very much for taking the time, and again, I look forward to continuing the health discussions with you. We will create a special series for you to bring things that you want to bring forward to educating the public, So whenever you're available and you all want to do it, we'll set that up. All right, Doc. So thank you very much for taking the time.
Okay, thank you all. Bye now. Bye.
Bye, Doc.
Bye, Doc.
So guys, any issue you want to bring forward? Let's hear it.
Well, Gary, I want to start with the joke of the day. The Prime Minister appointed Fitzgerald Hines or requested of Fitzgerald Hines to set up some committee or the other. So to me, it's a question of himself going to investigate himself, because we all know the fire services fall under the Ministry of National Security. So is it that Fitzgerald Hines is going to handpick people who will do his bidding? I mean, it's all within the ministry. That they can't be serious.
That it is very concerning to see what's happening in the country, to know how many complaints there has been about the fire service and the lack of resources. And we see billions of dollars being spent every year, budget allocation, and we don't see any improvement. I have serious concerns about the management structure of things and the level of supervision. I mean, the government is hired as the overall manager of all the managers, and we don't see that happening. So it is very concerning to see that. I mean,
No,
look
but
at what happened.
one of the things that I'm looking on with interest is, so you have a situation here where two ministries are basically slugging it out in public. Your public utilities and the fire services slugging it out in public. And then, surprise, surprise, a former head of the public service, I don't remember the guy's name now, came out on the news tonight and said that there is no way Reginald Armour could have been speaking the truth. Basically, he said he is lying. And this is a former head of the public service who would have been the permanent secretary to the prime minister. So the fighting is happening openly now. Very, very interesting.
Yeah, it's a ridiculous situation that is playing out in the PNM right now and in government. It's happening in energy also. Stuart Young came out this morning and talking about the losses that NGC is up to.
NGC.
Yeah,
Yeah.
but
But I think it all started within the PNM. It all started with Stuart Young's push for power. All right, that would have upset a lot of people, and as a result of that, you're seeing these things playing out in the public now. I think it really started with him.
yeah, but
Asi Kamla gave him some award the other night.
yeah, they went and negotiated Stuart Young, and you can remember in 2016, Stuart Young and Rowley jumped on a plane and they went Houston and they went Japan and went all over and renegotiated all these contracts. Here it is 10 years later, you come in to say, well, negotiations that they made in 2013 is what is resulting. So what were you doing for the last 10 years? You were managing the affairs of the country in energy. And you did
but they were boasting. They were boasting that they fixed many of the problems or the errors made by Mr. Ramnarayan. They were boasting all along in the last 10 years that they were able to save the energy sector.
How is Mr. Ramnarayan going to know what the price on oil going to be in 2017 when he's negotiating in 2015? And Mr. Ramnarayan was not negotiating. It was the technocrats that were doing the negotiating. Ministers in government don't do negotiating. That is not their job. Stuart Young and Rowley changed that paradigm. They introduced that where ministers and prime ministers are going to negotiate to buy a boat and negotiate energy contract. That is not their sphere of expertise.
Well, is one thing for the prime minister and the minister to head the delegation, but you're not even carrying the technocrats with you.
Exactly.
That
Exactly.
is the dangerous point.
They went to buy a boat and they don't know what a propeller looks like.
Well, exactly. They don't have the expertise, and you don't carry people with the expertise, so then you end up with what you end up with. And we saw what became of the boats that they bought in Australia. No good. No
But
good.
they never worked.
Well, exactly. So when you have a lawyer and a rock scientist buying boats, what do you expect?
Yeah, they bought 4 boats for Tobago. Where is the Galleon's Passage? What is that doing right now?
Probably on dry dock somewhere.
Right.
I remember too good with that story, about the PNM send some fellas in Miami to buy a crane, and they buy the crane because they look big, and the crane didn't have the capacity, and then they come back and they throw the crane in the sea because they didn't know how to operate it, and they had to get a certain guy who didn't want to give the job to get to use his crane to pull them out. I won't call the guy name and who the guy is, but this is a long history of the PNM putting people in charge who lacks the knowledge and capabilities to make the right decision and do the job. And it's fairly strictly for political reasons. It's like PNM country, it does not belong to anybody else. No, none of the taxpaying citizens has the right to any resource only because you have a PNM party card, you qualify. And this nonsense, this political biasness has to stop in the country. We have to put an end to that. Citizens have to realize that they've been shortchanged because people are appointed position because of political reasons, and they're not capable.
Yeah,
It's the same thing you see happening in the police force. This is where we are with our security service. People are appointed positions because of affiliations and not qualified. You know,
yeah, but
we,
Gary, the thing with that is, when you do that, and if they, because the PNM is in a second term, it is beginning to show up, because once you put square pegs in wrong holes, it's only for so long they can rally. Eventually, their true colors are going to show up, and their incompetence will come to the surface. And when we look at Limo, it's mistake after mistake after mistake the guy
that's
is
right.
making,
It flows up
right?
like
That's right.
oil. It flows up like oil. The incompetence, flows up like oil. It's showing clearly.
And this man is still holding on to his job. I mean, he comes on national television and lies openly to the population, and he
Who
still has a job.
who does the PNM have to replace him? Who they going to put? Scotland? They're
But
going
who
to
could be worse? But who could be worse than
Marvin
this attorney
Marvin
general?
Gonzalez.
The
Who they going
PNM has to replace itself. All of them have to go. All.
who is a competent person knowledgeable about law to put? They're going to have to Arawi might be the best candidate because
I'll
Well,
tell you, Harari did a
yeah,
hell of a better job than him.
he did a better job than Limo for sure, right? But I don't think he's gonna go back there because the politics playing out there. They have to put him in the doghouse somewhere. Stuart Young
Well,
and his band will ensure that he stays somewhere in the background.
we have to start educating the population and letting them understand what the PNM really is. Eric William was serious when he said you could take a crapo and run this country, and that is what he's doing. He's taking
But I mean,
40,
I know some
41
of you,
crapo.
some of you guys have been around longer than me, but I don't know in my lifetime that I have ever seen, not even in 1986 when the PNM lost 33-3. I have never seen the PNM unravel as they are unraveling now.
Yeah, well, because they in the first 30 years, you have to understand what happened in politics in the first 30 years. In the first 30 years, PNM cemented themselves with those 30 consecutive years of government, so where they controlled everything, and we did not have social media, and we weren't able to understand and to the population didn't know what was going on. We had to only take in what was coming in on the radio station. And for those 30 years, we had 2 radio stations and 2 newspapers, and they were all controlled by the
By the
PNM.
PNM. Yeah, yeah. No, you're right.
So,
You're right. Now,
so
now we get it instantaneously now.
correct. And why do we have this? Because in 1986, when the NAR took over government, they changed that. They changed that and they opened up the media and
Open
they
up
allowed
the media.
other
Yeah,
radio
yeah,
stations,
yeah,
other
yeah.
TV stations, and other other forms of media, and that is where we were able to educate the population because the media was now not controlled by the government.
Yep.
And what
And,
were
and and that is why I don't make a big deal when people tell me that the PNM still control the main media houses. That don't bother me anymore because people don't depend on them for news anymore anyway.
correct, correct,
Well,
correct.
in this time with social media now,
Yeah,
we have put the print media in a serious backseat, and where they are writing what we print on social media or what we say on social
exactly,
media. So
exactly.
the news is hitting social media, TikTok, YouTube, Instagram, Facebook, whatever out there, Twitter, whatever, people have an opportunity. And this is what I don't understand with a lot of our young people who were given free laptops in the country, who their parents buy smart devices. I don't see them active, and this is what I would like to see them
Well,
active addressing issues in the country.
I'll tell
The
you something.
smartphone.
Tell you something, Gary. I was looking at the youth parliament today. Was on the parliament, and all of those youths speaking on both sides of the divide. There were youths representing the government and youths representing the opposition, and every one of them they were discussing
What
AI.
address? Left side. Food.
Yeah, they were
Food
addressing
good. Food coming on.
um AI in education, and they touched on all the issues that we're facing. Their discussions and their debating was touching on all the issues. They were able to tie in all the stuff that affects us daily. So it is not that the young people are not aware; they are aware. We just not getting the masses of them to be interested in politics and to vote, and that's why we have to get the message out there so that young people will understand and get away from this innuendo and this movie lang and this gossip politics and discussions that the PNM likes to introduce and some of the other third parties like to introduce into the politics that causes the PNM to win.
Yeah. No, use the link. You join the YouTube. You are joining the real link. I was supposed to come in with. You run the wrong link. Let's send it to you. Let's send it to you on the phone. Right. Okay.
Well, good.
So that's Senator Damian. He's going to join us. So you guys can continue the conversation. Sorry about that.
No. I was just mentioning young people. We have to make them more aware. And this discussion we had, the questions that Arjun asked to Dr. Bodo to identify, enlighten the listeners about what the UNC is doing and what they plan to do. That is where we have to take the discussion.
Yeah, we had to spend the next. I mean, bashing the PNM is one thing, but we have to really spend the next few months bringing out to the
Reinforce it.
fore the
Yeah.
policies.
Correct. The
Yeah.
people,
Policies.
the population is already fed up with the PNM. Telling
Yeah, yeah. We don't need. That's a dead horse. We don't need to beat that anymore. We
But
now need to give them hope.
we need
I
to
need to
show
see
them
some
this
inclusion with
now.
the young people here now.
No, but what that initiative that you spoke about there, Gary, where you get there's a serious brain drain happening with among public health officials, right? And we need to give them hope because you have 100 doctors graduating from the Mount Hope Medical School every year, and none of them are getting jobs.
Yeah, because the
We
PNM
need to
is
give
not
them an
interested.
internship opportunity where we could definitely use the help in the hospitals. Every medical
Yes, but those
profession knows
guys
that.
those guys are feeling hopeless. The system doesn't give them hope. So we need to get the message out there in terms of what the policy is going to be with the incoming government, and give them hope.
Yeah, you are correct. But you see, the PNM, they just wanted to create the impression that there's a hospital. It's like what I was saying. They just creating glorified hospital. They're not thinking about holistic development of this country. They never. That was never their premise.
Yeah, but this Kumar, this is gonna sound like a joke, but I think it's a deliberate policy of the PNM to have this brain drain happening, especially in the medical field.
Well, of course, it's not just in every field, in every single field. They don't. They don't want to have educated people. That is what the premise of the PNM has always been
Yeah, but
since
particularly
1956.
because of the ethnic mix in medical science.
No, it doesn't have anything to do with. I don't like it when the conversation goes into ethnicity. It's not about ethnicity. It's about controlling people. It's about
Well, that too, but a minor part of that is, and don't put it beyond them. I mean, look at the 25,000 thing. That wasn't by no accident. That was deliberate, right? And while we may choose to say, well, boy, I ain't going down that
Let's
road.
chat and try to have
When
Senator Damian, okay?
when the PNM sit down in the caucuses and wherever, these things come up as in the floor, you know. These things are important to them.
Yeah, because their base voters are people who live day to day. They have invented, they have created that base structure that they have. If you look at the where the constituencies are and how the PNM, how Eric, this is not the PNM, this is Eric Williams created that in the East-West corridor. He created the east-west corridor, so he will always have that base voters. That part from Barataria roundabout go west. That is where the PNM dominance is.
Yeah.
That's all that it is. They have close to 9 constituencies inside, 9 or 12 constituencies. I
Yeah.
can't remember.
And
12 constituencies.
I don't know how many people, despite what they say in terms of the numbers and constituencies, I don't know how you find in those kinds of numbers
No,
in a
but
Spain South seat and all of
look at
those seats.
Kamla brought it up. If you look at what is happening with the elections boundaries, you don't have a proper list. You haven't eliminated dead people, and you are changing polling division based on numbers to make everything equal. So what you're going to do? You put all the dead people in one constituency and call one polling division and say there's a UNC polling division. That is essentially what that is.
What has the ABC been doing for the last 8, 9 years? Seriously.
Collecting money and looking to change boundaries, analyzing
You,
voting.
you can't come on the verge of a general election and tell me that you haven't completed your work. What were you doing?
Well,
What were you doing?
exactly. Well, the same thing is like we were talking about the healthcare. They just build a hospital and put guard around. I went down to the Point Fortin Hospital, and it have more guards inside there than nurses and doctors. Nearly at every doorway, at the elevator, you're meeting a guard. Two fellas sitting down with, and it's a paid security guard, contracted security guards.
Yep, yep, yep.
It's all about money laundering. That is what it is. We have more
It's a
security
much
guards in the
different in
hospital.
San Fernando Hospital, Lyder.
In Point Hospital have more security guards than doctors and nurses.
Yeah, the position at the base of every step of the San Fernando General Hospital. Plus, when you go up on the floors, they are present everywhere.
Yeah. It's about contracts with the boys. That has never changed from 1956 till now. That was with the PNM strategy. Make jobs and is menial jobs. And those are their voting banks. They create jobs for. That's
Yeah.
what it's always about with the PNM. And that is why I don't like the ethnic discussion. Because those people are oppressed and they don't know they're oppressed.
It's a
They
sad
don't,
state. Very sad state.
they don't know they're oppressed. They don't know that they are being hoarded like sheep into a corner to accept whatever comes in the trough. They don't know if what that it have different kind of feed. They get in the basic hog ration as food, and that is it. They
Yeah.
they settle for they have technically dedicated their voter base into accepting mediocrity. When Camille talk about, well, I didn't pass maths and I as a lawyer, and Gerald talk, well, yeah, I failed common entrance twice and I only get my subjects one subject at a time for 5 years and now I'm a lawyer and I'm a minister. That is teaching the people mediocrity.
Mediocrity will get you by. You will get through. Don't worry.
Yeah, you'll get through. You could fail all your exam and you'll get job. Eric Williams.
We love you, so we'll take good care of you.
Yes, Eric. That is what Eric meant when he said we will take any crap one, put them in a suit, and they could be a minister. He did that. And that is what he taught their voter base, and that is what the police service is, and that is what the army is, and that is what the Coast Guard is, and that is what the other
Yeah, but
institutions
when
are.
I saw the social development minister backtrack and flip and do the flip between yesterday and today,
Yeah,
I started to question whether she's one of those who didn't even pass the common entrance, you know.
yeah, but look,
To do some
Rowdy said it.
acrobats. So my question is, where did she get the impression that the pension was like a poor relief grant then? The
No, but she has
pension,
been
as
no,
far
but
as we know,
she has been singing that song for quite a while now, you know. That it is not
yeah,
a
yeah,
right, it is a grant. She's been singing that song for a while now.
They are
yeah.
looking for ways and means where they could cut and shave and get you to accept whatever they tell you so that they can save money to steal. That is what it's all about.
Welcome, Senator Lyder. We got Senator Lyder in the house.
Good
Welcome.
evening, good evening, Gary. Good evening, Gary. I seen Trinita the Bone. I seen all kind of big people there tonight, boy. Oh God, boy. Action pack
Yeah.
house.
Well,
How we going?
I want you to start to talk about this nonsense that our friend Mr. Smallpin talking about. I know you will be an expert in Smallpin because you always talking with Anil. So
Well,
this
I don't know. I can't personally tell you. I know about small pin. It ain't to do with me, but I know it about a fella named Small Pin. Tell me, what's the question?
no, he made an announcement sometime today. I saw a post somewhere that NGC, the loss in NGC is as a result of a deal, um, a purchase or no, an arrangement that they had with CG, with what's the name of this place? Wait, let me pull it up again. Yes.
Well,
With
I want to say from the onset, I did not see the article, so I don't know. I can't really speak on it. And furthermore, you know, each of us we shadow various things in ministries and so on, as the opposition. I don't focus heavily on the oil and gas sector. We have MPs and senators who are quite familiar with the ins and outs of the oil and gas sector. But I personally am not now guys, I'm on 3%. Let me try to get a charger, all right? Give me 1 second.
yeah, your
Give me 1 second.
So go ahead, guys. Give him a chance to.
For like
Arjun, you saw the article.
Yeah, you can try my
looking for that
Um,
charger.
somebody, people, if
All
you're
right,
not
I see.
turn your mic off because we get
Sorry.
only turn on your mic when you're talking.
Sorry, I'm getting a charger now. So 1 second. Oh, this works perfect. Thank you. Thank you very much. Thank you very much. Right. Let me get this on. Right. Okay. Okay, I'm good to go.
Yeah, what I was saying is there Stuart Young made a rebuttal about the losses in NGC, and he's saying that that was because the People's Partnership government made some deals in 2013, and that is why there are losses in NGC because they made some negotiated some arrangement with PPGL,
You know,
PPGL.
listen. Let me stop you there, right? Let me tell you something. Now, again, I am not an expert in the energy sector, but what I am an expert in is BS. You know what BS
Correct.
represents?
Well, I know
Right,
you would know that
right,
is because I know it's BSE talking
right.
about
And
because
and and Stuart Young is the master of BS because what happens with Stuart Young, it is always convenient to him to take credit for successes, any small successes in the energy sector, but then to want to blame the past government for any failures, right?
Failures, correct.
And in fact, I was actually just speaking to my uncle who is from the oil and gas sector, who I'm here with at a family function. As you know, it's Christmas time and families coming together, and and he laughed about Stuart Young and some of the, you would have seen some videos circulating with Stuart Young boasting about Touchstone and boasting about several other big projects that he cut in ribbon and so on, and saying your PNM government working for you. And at the end of the day, all those projects were initiated under Kamala Prasad-Bisesa and Kevin Ramnarine as the Minister of Energy.
Correct.
And they're now coming to fruition today. If anybody knows properly about the energy sector, as my uncle had explained, many times when you enter into some arrangement or agreement with energy companies, many times it takes 5 to 10 years before that project starts to bear fruit and comes to fruition, right? So that's why the Prime Minister could tell you, wait until 2027 is when the next time we're going to get a gas boom in the country, because he knows through Shell that Shell has already said that from the Lauren Manatee field that we will see gas come from that at earliest 2027. Now that is at earliest, but I could tell you 2 years ago Shell was saying 2026. So we know that things like this can always have delays, and I sincerely believe if it's not late 2027, it'll be 2028 when Lauren Manatee field comes on, right? Again, I cannot pronounce on the technical aspects of the energy, but that's what Stuart Young does. Stuart Young wants to take credit for the things we've done and then try to throw us under the bus for some deal we made with NGC. And if you had Kevin Ramnarine on this program here today, he would explain to you why NGC is making a loss, and the deals that Rowley and Smallpin made going to try to negotiate themselves with them fellas in Houston and so on and getting bamboozled, right? He will explain to you why NGC making a loss today, right? The same way he comes inside, the same way he came in the parliament in this budget debate and said, oh, UNC always talking about Petrotrin and it was a foreign exchange net earner, and it was not, and we were losing money, and we're going to do this. And then a video comes out with Colin Imbert as the Minister of Finance. The Minister of Finance now, this is the fellow who's supposed to know what's going on with the money.
Right.
Who clearly stated that part of the foreign exchange issue we have today is on a part of the closure of Petrotrin, which was a net foreign exchange earner. So he completely contradicts what Smallpin, his own colleague, well, I should say his rival for prime ministership, acting prime ministership now, because as you know, Rowley no longer puts Imbert. Imbert seems to have fallen out of favor. And now he puts Stuart Young as prime minister all the time, right? So Imbert comes out and says Petrotrin, the shutting down of Petrotrin, which was a net foreign exchange earner, was one of the main causes behind the foreign exchange issue today. And I could tell you it was $350 million that Petrotrin contributed to the foreign reserves, foreign exchange in this country per annum. So I don't believe a word that Stuart comes out of Stuart Young's mouth. He's an absolute deceiver. He's an absolute mama guy. He is very famous in peddling mistruths, right? He believes that everybody's gullible. He believes everybody has to listen to his semi-Faris Salwari type accent, right? And we supposed to just believe everything come out his mouth. Okay?
Minister of Misinformation.
He is a failed Minister of Energy. He has crashed the energy sector. He is part of a government that has crashed the energy sector, and the entire failure and collapse of this energy sector falls squarely on the chest and shoulders of this government. Not under Kamala Prasad-Bisesa. Our track record show that the energy sector was in growth under Kamala Prasad-Bisesa between 10 and 15. And that what we see today that's keeping us going is because of the deals made by us, because of the contracts signed by Kevin Ramnarine, because of the onshore oil finds, the on-land oil finds. You know how many on-land contracts were signed off by Kevin Ramnarine for oil?
Correct.
Okay? The PNM never focused on that. It was us who did that. So
Yep.
it's good for him to when he wanna go and pose with Touchstone and them and don't realize it's Kevin Ramnarine and Kamala Prasad Bisesa who were the architects of all of these things that we see here today. But I don't want to talk. I really, Gary, and when you invited me to come on, I wanted to come on and deal with some matters of interest. And I promised myself I didn't want to get up. I didn't want to get too upset because I'm in a family function. But boy, just the talk, just the conversation behind Stuart Young and the AG sector. I'm upset now, man.
Yeah. We're gonna bring it back. But listen, we see people getting slashed, the children getting slashed inside their house, right? We see business people the children getting snatched. We see recently up to today, I have some pictures in front of me here, where a businessman gone down and a person left the bank and shot. I mean, I've seen the pictures in front of me here, and we are very concerned about where we're heading. We have crossed over 600 murders now, so, and we have seen the incompetence of the management of the police, of the TTPS, right? The lack of response, police, the same, everything, everybody you talk to, police don't have car, the police can't respond effectively. I mean, so it's the same record, singing song going on, with no end, and this is something that is very concerning.
Let me tell you. Let me tell you. It's so funny that you bring that up, right? It's not funny, but it's funny you bring it up because I can safely say now that you could bring up a conversation of any ministry in this country today, and all you have is a matter of collapse and failure on the part of every single minister in every ministry.
Exactly.
Right? The only difference is who more extreme in their failure than the other. So what you have done, you've started off the program with me with an absolute significant failure, which has our economy upside down and in a total shambles now, where we're in deficit every year, where we are borrowing from 78 billion dollars under Kamala Prasad Bisesa down now $141 billion borrowed under this government. They almost doubled the debt of the national debt, right? So the oil and gas sector collapsed us. But along with that, another spectacular failure when it comes to the management of this government is that of national security. And you have mentioned some very pertinent things that, situations that have happened just recently. And in fact, I'm glad you brought it up because in fact, it's a matter of a failure in national security, a complete collapse in national security. Now, national security, as we know, spans in everything from the Trinidad and Tobago Police Service, it spans to the military, the army, right? It spans to the Coast Guard, it spans to prisons, and it goes to the fire services, right? So what we're seeing is an absolute collapse in all of these agencies. And we saw that through Inform a couple of days ago with a very unfortunate, and I want to say for the record, the member of parliament who passed away in that fire. I want to say that though she may be a member of the PNM and our political enemy, she is a human. She is she's a life. We don't wanna ever see something like that happen to any of our citizens in this country. And yes, we know that there were 2 old people that perished in the Southland because the fire tender couldn't get through a road. We know that a number of children died in Rookery Nook by Maraval because they couldn't get a working fire tender to come and out the fire. We know all of that. But I, by no means, want to throw scorn upon...
I didn't see no minister bawling down there when them children die. I didn't see no minister outside bawling down there.
Yeah,
all right?
I know. But you know what, guys? Let me tell you. I understand all of that, and I know that a lot of people have said these things, but what I want to do is look at it from a different angle, because I sincerely wish that never happened to that member of parliament. That was a horrible way for her to go, and it was a horrible way for her children to go as well. And my heart goes out to the family and loved ones of Lisa Morris Julian, and I really don't wish ill. I really don't. That's all right. And I really don't wish ill to her. So, but what this is a clear example of failure from the PNM that has actually now come home to roost. It has actually come to their own doorsteps today. It is a situation today where it is directly impacted someone who sits within the walls of power, that sits in a ministry that represents the People's National Movement, and it's come home to their house. And yes, it has come home. And what we have to say and ask is, why did this happen? Why did this happen? Why should this happen? Why should this happen to her? Why should this happen to the old people down in the Southland? Why should it happen to the children in Rukarinook? And it is because, and it shouldn't happen. But why has it happened? And it has happened because we have a failed Minister of National Security who does not have the testicular fortitude to stand up in a cabinet meeting, to take charge of a ministry and to ensure that the proper resources are allocated to in the right way, so that goods and services can be delivered to the people of Trinidad and Tobago. And in this particular instance, the goods and services include working fire tenders, as well as a proper supply of water. Because these are the two situations that happen. You have Marvin Gonzalez, a total, absolute failure and mamagai in his ministry, trying to tell people they had water in the taps. When the fire service comes out and said there was problems with water in the area, said they had to call, admitted that they had to call the corporation to bring water. And then they say they only had one working fire tender for Arima. There's a mayor in Arima. This is not a regional corporation. There's a mayor, not a chairman here. So one working fire tender there and one all the way in Tunapuna. And they're telling you that both fire attendants was out in fire somewhere else. Now let me say this to you. I understand that the survey was done and there's only between 8 to 10 proper working fire tenders in this country today. And I'm going to verify it, but I have been told that there's only between 8 to 10 working fire tenders in this country today. Right? Throughout the whole length and breadth of Trinidad and Tobago. Right? Now think about that for a second. Think about, we have 1.4 million people living in this country, thousands of homes, a failing infrastructure where we see all kinds of problems with tea and tech and all these things like.
We lost him.
Yeah, I think either the internet or something went wrong there, but I mean,
basically what he's saying is correct.
Hello, you all hearing me?
Well, we missed you for a little bit.
Froze a little bit there, but we're hearing you now.
So you saw it in the news today that the professor from UE, Indira Sajawan, a power line fell and almost caught her house fire. You see all of this here today. You hear about all these issues with fires in the country. All these issues with people dying in their homes. People who are dying in their homes because why? Because they have to be locked up in their homes behind steel bars, like a jail cell. Because if you don't do that, somebody coming through your window to lock your neck, chop you, rob you, rape you, steal from you, kill you. Right? So everybody now has to live in jail cells. So when a house catch fire now, if you don't have a proper exit, you're dead. So you have a problem creating another problem. And then you have now a fire service that is totally under-resourced, where firefighters have complained that they don't have the proper breathing apparatus for them to go into a smoke-filled house to save people. They don't have the correct suits, to be enough of the correct suits to go inside to protect them, to save people. They don't have working fire attendants. I think the other day, a fireman fall out of a fire truck because a door fall off of the fire truck. Now, I want you to take that in for a minute, right? Take in the fact that people in the last 2 years have died in fires. And every single time they die, gentlemen, it is as a reason. You hear the same story. They don't have a proper fire truck. They don't have no water. They don't have none of that. And you know what that makes me think about, guys? That makes me think about the billions of dollars being spent in national security over the almost 10 years that this government has come into power. And you know what is the most glaring and disrespectful and nasty decision ever made? Is you, as a government coming in 2015, towards the end of 2015, the PNM coming in, Kamala Prasad, the Cessor, spent taxpayers' money to purchase 6 Daman vessels, 6 OPVs, and each of these 6 Daman vessels all have interceptor vessels on them. So it's 12 boats in total, but each of the 6 have a small interceptor. So these Daman vessels were to patrol our shores, to stop the guns, drugs, ammunition, gang members, prostitutes, right, amongst illegal immigrants from coming in, right? And if you're out there patrolling and one of them drug boats take off, you have an interceptor you could put into the water and shoot after them, right? And go after them. And these fellas came into power, received these 6 vessels in 2016, and to this day, not one of those vessels are working today. The maintenance contract on all 6 of the vessels were cancelled. They have not been in use. They are all broken down. And Keith Rowley and Stuart Young see it fit to jump on a plane, go all the way down to Australia, because remember, they are the best negotiators in the world, and sit down and negotiate $600 million. $600 million, which is financed, so that is more debt in US dollars that we have to pay back. 600 million TT, or 100 million US dollars, right? To buy 2 hostile Cape class vessels that's sitting down, one of them not working, and the other one only just got repaired. And you know where they are right now? They're down sitting down in Shaka Shakari. If you go down in Shaka Shakari now in the bay, the one boat down there, because somebody doing some work down there, and they're down there sitting down in Shaka Shakari. Not patrolling the shores, to stop guns and drugs, but they're down in Shaka Shakari. I saw it with my own eyes a week and a half ago when I went fishing. So they found it right to spend 600 million Trinidad and Tobago dollars borrow that money, and you have to pay it back in US, to buy 2 hostile vessels when you had 6 damn good working Daman vessels that you could have kept working well, that you could have maintained, that you trained the crew for it, you did not need these 2 new vessels. These vessels, 4 vessels were meant to go in patrol, and 2 were utility vessels. So you would have had 3 vessels patrolling the perimeter of Trinidad and 1 vessel patrolling the perimeter of Tobago. And you have 2 utility vessels that were meant to go out there to relieve men, bring close down. You have a utility boat now. You could retrofit now and put the guns on and so on and go back out. But they found it right to spend 600 million on 2 hostile vessels. And then the Prime Minister comes in that ceremony, cuts the ribbon, tells the whole nation, I could sleep good at night now. Now that we have these 2 vessels. But yet those 2 vessels, just like the 6 Daman vessels, sitting down in Stobles Bay, not working, not patrolling, not doing nothing, collecting rust, falling apart, right? Not protecting our shores, not stopping the drugs, the guns, the ammunition, the illegal immigrants from coming in. Every single day, you see 7, 8, 9, 10 Venezuelan fishing boats sailing straight into Chaguaramas. No checks and balances, no immigration, no customs and excise, no Coast Guard stopping them, no nothing, and pulling up into our shores. Venezuelans jumping off our jetties. They're coming in the fishing boats with about 50 people hanging off the sides of the damn fishing boat, pulling up to our jetty and coming off in our country, walking off in our country. $300 US one way, $300 US the next way. That's what I was told, that they pay to go back and forth. They come here, they go in a price mart, shopping, taking goods, buying goods, putting back on the boat, some going back, some staying here. But plenty going back now because plenty of them catching their tail in Trinidad because Trinidad economy gone through. So they realize, you know something, boy, it's better we go and suffer back in our hometown than suffer here in Trinidad. But that is what is going on with the Coast Guard. That they are under-resourced, they are underfunded, they have given no direction from, no policy directions from the government because you have a failed minister and you have a failed cabinet and a failed prime minister with a failed small pin who went on and spent $600 million of taxpayers' money to buy 2 vessels that they did not need, that the Coast Guard never required, that they never wanted. I was told that what the Coast Guard wanted was smaller vessels. They wanted small vessels that they could do quick in and out patrols in close coastline. Right now, fellas, right now as I talk to you, if you jump in a boat and you go up the north coast of Trinidad, listen carefully, you go up the north coast of Trinidad, past just a little bit past what you call it, this bay down in the back of Shagaramas there, oh God, I forget the name now.
Shakashakari? Is it Shakashakari?
No, not Shakashakari. You're on the north coast of Trinidad now as if you're heading towards Maracas, right? And you're on the north coast, and there is a cove. There is a cove inside of there with jungle and forest behind it. And you could go there now and see 6 Venezuelan boats tied up to the side of the land there. And I asked myself the question, what the hell is going on there? How could these foreign boats be tied up to a forest in the back there? What's going on? Now, maybe they are just innocent fishermen illegally fishing our waters. Or maybe there's something more in the water than the pestle up in the back there. But what I didn't see is any Coast Guard going and interviewing them and seeing what's going on with them. Now, I'm not casting any aspersions upon those people. But if they can do that, couldn't a drug runner or a gun runner simply pull their boat straight up onto our land, tie up to a tree, and move the guns and drugs through the forest? Couldn't they do that?
We are just a few miles off of Venezuela, and that's been done frequently. You know,
but I tell you, me and analysts go fishing. We see it all the time, Gary. We see it all the time, and we ask ourselves, what is going on? And I don't want to blame the Coast Guard. I want to blame the fact that the Coast Guard is under-resourced. The government has failed in providing proper policy and direction to the Coast Guard with proper mandates to the Coast Guard. And all they've done is done window dressing by spending $600 million on 2 hostile vessels that park up and broken down. And so I asked myself the question, if you didn't need those 2 new hostile vessels because you had 6 new Damian vessels that came in 2016, couldn't you have spent that? And by the way, we were also told that another country bought 2 hostile vessels of similar ilk, and it costs $50 million US, half the price. So I don't know who make what, who is the broker, who sell them vessels, who is the front man. I don't know, but I find them very expensive.
Money for their back pocket. I guess somebody allocate money for their back pocket.
Again, I cannot cast aspersions upon anyone, but all I'm saying is we have information that 2 vessels of that type, of that similar ilk, and you know, of the entire makeup sold for half the price to another country. But stick a pin there, stick a small pin there. 600 million. How many fire trucks? How many police cars? How much resource the fire service could have gotten if that $600 million was used to properly outfit our fire stations and to properly ensure that there was water running in the lines by our fire hydrants, so that the fire service didn't have to call the corporation to bring water trucks so they could hook up and pelt water into a blazing fire, and so that we didn't lose a member of parliament, or we didn't lose her children who perished, shamefully perished. It is a failure of this government They have failed their own. They have failed one of their own. Sadly, they have failed one of their own. They could have used the $600 million, man, to buy fire trucks. But no. You see, guess what? You can't do your kankalang. You can't do your kankalang with them small fire trucks. But you could pay $600 million for 2 ships. And if this and if for some reason the broker fee was very high, you know what could play off there.
Right. We need to see the invoice. But what I'm concerned about, Senator Damian, is that the repair of the Coast Guard vessels. Why it is that we cannot train people in Trinidad as another? This would be another job opportunity for people to repair the boats. And the other thing is that I'm concerned about is that there seems to be the mishandling of the equipment, whether it's the police cars or the Coast Guard vehicles and vessels. There could be some of them that are not handling it properly. So there has to be some kind of checklist when the change of shift. So there's accountability on the usage. Besides that, that they repair the vehicle. Now I am saying that they repair the police cars. We have a lot. This is a lot of job opportunity for people repair the Coast Guard vessels. It's something that we could train on the ground in Trinidad. We don't have to send these vessels overseas to be repaired. Why it is that we, and in this stage of the game, with the amount of money we're spending, don't have people trained to do that. And
hold on. You see where you now walk into there, Gary? Let me tell you why that car even work right now. It could have worked 2 years ago. Were you saying that? Could have worked 2 years ago. But do you know why that can't work now?
Well, I'm sorry I said not now, but what I'm saying for the length of time, what I'm saying to you.
No. Well, remember, when we bought those 6 Diamond vessels, they came with service level agreements. So they were trained technicians for the company that was there to help maintain the boats. Another element of not just maintenance is training. And you have to allocate the resources for training. So if the government is broke, if the government is allocating $600 million to 2 new hostile vessels, instead of allocating part of that money to constantly and consistently train Coast Guard how to handle the boat properly, train local people how to maintain the boat properly. That's what it is, It is the lack of will of this government to put the proper resources there to ensure proper training, proper maintenance. And we see that not only with Coast Guard vessels, we see that with the cars. VEMCOT was created to be that government agency that fixes these police cars and put them back out. But what we see now, VEMCOT is a graveyard. VEMCOT is nothing more than a graveyard today of old cars. So it's a lack of training, a lack of maintenance, but more importantly, it's a lack of, for the Coast Guard vessels, it's a lack of facilities. Let me remind the people listening to this program that it was under this PNM government 2 years ago to this day, when they took over the Shagaramas dry dock facility that was owned by CLICO, and the government took that over from the CLICO as part of the repayment for CLICO, for the money lent. The government had a dry dock facility that was, and when I say recently renovated, we're talking 15 years ago. 15 years ago, recently overhauling an entire dry dock is recent, right? And they took this dry dock, and because of poor maintenance, we come back to maintenance again, and poor training, the dry dock, the two, let me try to explain. There's 2 like big metal sort of canisters that fill with air or whatever it is, and that raises the dry dock out of the water, right? To bring the boats up. Those got corroded, and then one day they dissipated, holes came in them, and the dry dock, which was up in the air, crashed into the seabed and destroyed. And because of a lack of maintenance by this government, we lost our one and only dry dock in this country. That dry dock used to repair the Tobago ferries, the taxi boats. People from Guyana and Suriname used to bring their boats in to repair by us, foreign exchange. That is where the Coast Guard vessels were to go to get repaired. So if you wanted to train locals to maintain the Coast Guard vessels, where were they going to maintain it? It had to be the dry dock. You have to bring them up out the water, right? We're not talking about just repairs on the inside, but you have to go underneath the boats and maintain them, pull them up on dry dock. But we have no dry dock facility again. So that is why we asked the question in the Senate, because a little birdie told us that one of the hostile vessels was completely down and the other one was working at halfway, and one had to drag the other one up to Dominican Republic to be dry dock up in the Dominican Republic.
Because
we asked that question.
Of the negligence. Because of negligence.
Yes, because they crashed and destroyed the dry dock and sent home a large number of workers. As a result of that, lost their jobs because they crashed our dry dock, our only dry dock that was bringing foreign exchange in the country, that was helping us to repair our boats. And you know what they did the other day? They bought in a mobile dry dock, big kind of crane-like dry dock that can sail. And somebody get a lucrative contract to bring that inside of there so that they could repair one of the taxi boats or ferries or something like that. And we asked the question and put them on those, how much money was being spent on that dry dock? I think it was Dave Tank who asked the question. And when you hear the exorbitant amount of money that was spent every day to have that floating dry dock here, my God, why couldn't they just maintain what we had? The cost of maintaining what we had would have been, you could have had years of maintenance on what we spent on that floating dry dock. So that's the answer to your question, Gary. It makes no sense to have anybody trained to try to maintain the boats because we can't even dry dock them here. We have to send the Damian vessels. We have to send the Damian vessels down to Suriname, and we send the hostile vessels up in Domrep. So that is what is going on. Now let's bring it now back to home, back to the first question you asked, right? Or the first statement you asked.
Before you go there, Damian, let me remind the population of what an OPV is. An OPV is an offshore patrol vessel. They are supposed to be people that you will train to go out on those boats that are supposed to be able to repair those boats while it is in operation. They ask your crew. I work offshore. I can tell you I'm familiar with what we're talking about here.
Yeah.
The offshore patrol vessel is supposed to have a dedicated crew to work 12-hour shifts and there will be a man, there will be an electrician, and they will know the boat inside out. They will train
and so are you aware? Trini? Are you aware that for the 6 Damian vessels, there was a training done for a number of Coast Guard members who were trained on that boat, because each of those vessels only required 25 persons to operate it.
Correct.
A crew of 25, right? And there was more than 70 persons, if I'm not mistaken, trained to be able to manage those boats. And do you know what has happened to all of them? They've just been dispersed into the Coast Guard service. Just dispersed. Because they have not been operating the Damian vessels. And do you know why they have not been operating Damian vessels? Because they cannot even get a proper and constant supply of diesel to operate these vessels. And do you know why they can't get a proper and adequate supply of diesel to run these vessels? Because part of what was meant to happen if the United National Congress had won the election was that we had to build tank farms in Chagaramas to be able to fuel the vessels. Correct. So when these vessels are out there patrolling and they come back in to be fueled at their point of base. And this government received the 6 vessels, put them to park up and hang Independence Day flag on them to celebrate and decorate the whole place. Never use them to patrol. Only ever use the vessels in a reactionary manner. So if something go wrong and somebody get called out, the vessel goes out. And then when they come back in and they run out of fuel, and a fisherman in distress and call the Coast Guard say we don't have fuel to come out there. If you need something.
We have heard that in many instances.
We have heard it many times. And all these vessels are situated up in Stobles Bay. So what happened to a fisherman who's in distress down in Cacas, down in Cedrus? What happens to a fisherman who's in distress down there? You don't have to wait for a vessel to leave Stobles Bay and go all the way, but the people done dead, the people done drowned, the people gone. The one vessel they had, the one pirogue they had down in San Fernando sank. There was a video going around with the one pirogue they had down in San Fernando on a jetty San Fernando Coast Guard sink. So you don't have a proper supply of fuel, right? You're bad paying the people who supply you the fuel, so you're not getting a proper supply of fuel, so you can't patrol. You have trained persons who get dispersed because the boats are not being used. You have service levels agreements that were cancelled by the government, so you don't have proper maintenance from the source of where these boats come from. So what happens, gentlemen? You have a Coast Guard service that is underutilized, under-resourced, and not able to carry out the mandate that they are meant to do, which is to protect our shores, protect our coastline from the illegal importation of drugs, guns, and ammunition that is spilling the blood of our citizens in the streets of Trinidad and Tobago today. And not just gangsters, Not just gangsters killing gangsters now. Because as you opened with me just now, Gary, we hear about a woman getting her throat slit. We heard about a man getting gunned down in his business place. We hear about a young fella being kidnapped outside his father plant shop in St. Augustine, right there opposite a plaza where Massey supermarket is, in broad daylight. We see a grandfather. We see a grandfather being dragged out. A grandfather being dragged out of his house, thrown into a car.
Yeah, recently.
People being shot and killed, over 600 murders. And we know, yes, it's gang fighting gang. But why do we have this problem? We have this problem because people are so desperate in this country now. The economy is so bad. The social services, the social fabric of our society has completely collapsed. From education has collapsed. Social services has collapsed. The medical services in this country has collapsed.
Forget
so everything has collapsed. So do you know what happens? A young fella now who was not given the opportunity to get a proper education, who was not given the opportunity to get a proper job, who was not given the opportunity to be able to help his parents when they're old and they need pharmaceuticals. You know what he doing? He on the block. And the gangster on the block recruited him because the gangster on the block saying to him, partner, the government failure, everybody failure, I ain't go failure. Hold this piece of money. And while you're at it, hold this 9mm. While you're at it, hold this AK-47. And all you go and rob this place. And all you go and kidnap that man. And all you go and gun down that fella. And then these people get lured into the gangs, and gang warfare and gang membership becomes a lucrative venture. It becomes a lucrative venture where these poor young fellas who have no other hope in society because society has failed them, because the government has failed them, are now lured to go into this. And that's why we're seeing 600 murders today. And we are seeing murders in the most graphic, the most horrific that we've ever seen. You imagine, you look at that fella who was driving out of that plaza by Dim Sum King in South, leaving the casino. And you saw the way those two fellas come out of that car, block him, come out of the car and spray him with a fully automatic high-powered rifle. I could not believe what I was seeing.
I saw the video.
Those guns are coming from somewhere. They ain't coming from the United States of America like what Rowley want to imply. They're coming right there from Venezuela.
No, he
because
wants
they're
to
coming
blame
through
the
our
Americans, so
shores.
the Americans could put more money into his hand.
Right? Yeah, that's what you want to do. And let me tell you this. And even if they ain't coming through the illegal ports of Trinidad and Tobago, the guns and drugs coming through the legal ports of Trinidad and Tobago as well. You know why? Because they refuse to put scanners. They refuse to put scanners in the port. And you have to ask yourself the question, why? Why does a government come to us in the last 3 years promising scanners in the port? And 3 years now, we can't get proper, efficient, working scanners in most of the ports of in this country today. Why?
And I heard the one scanner, they had somebody back into it and mash it up, but I think that might have been deliberate too.
Well, you see, listen. There's no doubt about it that there exists corruption at all levels in this country, right? There's no doubt about that. So you have to accept that. But then you as a government have to understand that here's what's going on, partner. We have a job. We have a job to govern our country. And we can't have the tail wagging the dog. We have to make sure that we as a government insist, hold people to account, come down to the ground. Don't go to the ground when you have an election and touch people's hands. Go to the ground in the port. Go to the ground in the port and have the testicular fortitude to watch everybody inside the court port, whether they are customs, whether it's a stevedore, whatever you are, and say, we are putting functioning scanners in here. And we are going to put checks and balances on this. And if we have to put security, to man the scanners, then what do we have to do? You see, the thing is, yes, you can have sabotage, but then do you just put your hands up in the air and say, well, they're sabotaging the scanners, I guess we just have to live with that? Or do you as a government sit down in the cabinet and make a decision and empower your ministers through the permanent secretaries to ensure that you put something in place to be able to secure those scanners? You can't tell me that's impossible to do. Or is it that you, or is it that you just like it that way?
Conveniently.
Is it that you just like it that way? Right? I tell you something. When we form government, that is one of the first areas we are going to tackle under the Ministry of National Security. Kamala Prasad-Bissessa spoke about that when she read out her plans. And one of her plans is to make sure that every single port have operating scanners. Not one, but several operating scanners, so that we can not only scan containers properly and efficiently to make sure we don't have illicit products coming into the country, illegal and illicit products coming into the country, but also have multiple scanners so that people can get their containers out faster. Because how many businessmen today are complaining about demurrage, rent on the port, demurrage with the container companies, because we simply can't get the containers out of the port fast enough. So everything is broken down. The system is broken down. And the end result, guys, what we see is the final product, which is the Ministry of National Security completely collapsing because we have a runaway crime problem that has been caused by a government that has failed in every segment of administration. Remember, a police, a coast guard, a military man, they are to protect and serve. They are meant to be the ones to bring preventative action, right? So if somebody is a criminal, they deal with the criminal. But the criminal is not born at that moment. The criminal doesn't become the criminal at that moment. The criminal becomes that criminal because somewhere from his youth, growing up, the system has failed him. The government has failed him. The education system has failed him. The medical system and the hospitals have failed him. The social services have failed him.
Yeah,
the job market, the job market from a poor economy where over 64,000 jobs has been lost by this government. I said it in the last budget debate. This government lost 64,000 jobs today. We have 64,000 less workers today employed than we had under Kamla Prasad Bisesa. Kamla Prasad Bisesa added 50,000 new jobs in her time. These guys lost 60. So they took us way back to the Manning era and take 10,000 more for that. Right? So that is what we have on. So when you have a system broken, an entire social system broken from the seed, from the time the child born, going into nursery, all the way till the child becomes an adolescent, when the government and the system has failed them, that is what has driven many of these young fellas to a life of crime. They didn't just wake up as criminals, brother. They didn't just wake up as criminals. But the point is, they have become, some of them have become, many of them now have become criminals out of desperation to survive, out of seeing a free meal ticket, out of seeing it easy to make a big chunk of money and bling bling with gold chain and all these things, because the system failed them. Because when a single mother has to hold on 2 jobs to survive in this economy, and has no father at home to watch over the son or the daughter, and is the old granny trying to watch over them children going down the road. And who becomes the father? Who becomes the father figure? The gang leader. And he recruits you, and he brings you in, and you are the fella running inside, jumping out of that wet man car with a big machine gun in your hand and spraying down the place and killing people, and sometimes many innocent people getting killed. And then now you take all these young criminals who are now learning even higher levels of criminality and now getting into things like extortion. That is the biggest thing right now today. Besides the restarting of the kidnapping is extortion. Do you know how many business people today are being extorted? If you don't pay your money, if you don't pay this $50,000 a month, we come in and shoot you and kill you. It have a doubles man. Right by UE, on the opposite side of the highway from UE. Right? He's be in a corner. If you drive inside on the opposite side of the doubles man there, he had to stop operating for about 3 to 4 months because gangsters reached by him, extorted him, and tell him, if you don't give me $50,000, we will gun you down. So that man had to pull up his business and stop earning a living for 4 months until the police got around to that gangster. And they were successful in dealing with that particular gangster. But how many more gangsters are not being picked up and are conducting this thing called extortion? So business people today are living in fear. Business people today don't know if today is the day they go in their business and get their throat slit. If this is the day they go in the business and their daughter or their wife get raped in the business. If this is the day they go in the business and their son get kidnapped and pulled. Or if this is the day you go into the business where a man walk inside by you and tell you $50,000 or your neck. And that is what we live in today. And you telling me a whole constituency rejected Fitzgerald Hines and this prime minister, so callous, so don't care about this country. He still insists to double down on a failure by keeping Fitzgerald Hines as the Minister of National Security. I put it to you today that if the death of his own MP due to the failure coming out of the under-resourced fire service, remember I'm blaming the fire service for this, the failure of the under-resourced fire service who had to endure $20 million in wooden ladder. How much million in wooden ladder park up behind the fire station now that can't be used?
It was 1 million for the ladders, but it was 20 ladders.
Sorry. How much was 2 million? No, it was about 2 million, wasn't it?
1 million for the ladders, and it was 20 ladders.
Sorry, that's what I was thinking. 20 in my head. Sorry, fellas. It's a long night, and I with my family and things like that. So my head, I kind of was liming with them. I was liming with them. So I going off script or standing up inside of a washing machine room, right? Watch me. And a washing machine room, and I'm here. You know why I'm here? I'm here in my family event in a washing machine room because I care about my country. Because Kamala Prasad Bissessa is putting together a team of people who care about Trinidad and Tobago, who want to save this country. And that's why we will leave what we are doing to come and stand up here and bring the truth to the people of Trinidad and Tobago. And if I slip with the 20 million, thanks for correcting me there, Trini. It was 20, but 20 ladders for $1 million. Imagine that. And if the death of one of his own due to the failure and incompetence of a ministry led by Ethelbert Hines, and if he fire Hines with that, boy, I don't know, gentlemen, I don't know what to say again. The country.
We want the Prime Minister to fire himself from government and fire his whole cabinet. That's what we need right now.
Well, that is going to be done by Kamala Prasad Bissessa. She's going to fire him, right? She and the population of Trinidad and Tobago is going to fire him whenever he calls that election. We know it's within a year from now. So we are under a year from now, because the latest he could take it is November, right? So we are under a year today. And I'm saying to you, he will be fired by the people of Trinidad and Tobago when they appoint Kamala Prasad Bissessa as Prime Minister. But the bottom line is this: while that is going on, and while we see the morass that this country has become, the Prime Minister should at least try to have some level of decency in his heart to see that one of his own people has perished because of incompetence. And he should be firing Hines. Listen, the very next, if Kamala Prasad Bissessa was in power and Prime Minister, her Minister of National Security, and we are a city. Well, first of all, a Minister of National Security would never still be the Minister of National Security if we had a murder rate of 600. That fella would be gone. Kamala would have gotten rid of that person already, right? We certainly wouldn't have had a minister employed as a Minister of National Security under Kamala Prasad Bissessa if every one of our Coast Guard vessels were down. We certainly wouldn't have a Minister of National Security hired still today if 8 of our 10 helicopters gone. So when we sit down in the Independence Parade, we didn't see 2 helicopters passing. When back in our time, you could have seen 7, 8 helicopters flying by in the parade. And most certainly, Kamala Prasad Bissessa would have fired the Minister of National Security the next day if one of our soldiers died given the incompetence. She would have done that. You know, people used to argue and complain that they used to say, oh, how Kamala firing so much people, boy, 30-something people, board members, this, that. You know why? Because Kamala Prasad Bissessa never put up with incompetence, never put up with misappropriation and misbehavior. Once you were caught in something, misbehavior, incompetence, whatever, she took action and took swift action. And so therefore, that is why so many people, from board members to chairmen to MPs who were ministers, got fired under Kamala Prasad Bissessa, because she did not tolerate misbehavior and incompetence, right? And that is why between 2010 and 2015, we had an economy that was growing year after year. That is why we had no problem with foreign exchange in the country. That is why we had a growing energy sector instead of a declining energy sector. That is why we had growth. We had the best ease of doing business in our history. We placed 68th in the world in the ease of doing business. The last time the World Bank did the measure 3 years ago, we were 105 in the world under the PNM. And if the World Bank was still doing that measure, we could be 110 to 120 today. Kamala Prasad Bissessa, don't watch that small woman. Don't watch that small woman and take her for granted, brother. That woman sharp like a razor. That lady is brilliant. That lady is experienced. And she's no nonsense. You mess around in her cabinet, you mess around in her state board, she will replace you. She will get rid of you. And she says she has no apologies for doing that. But in this Keith Rowley administration, how many people has he ever fired? How much incompetence have you seen? And the man only fire Marley McDonald, what it is, 3 times? but fire Marley McDonald because she bring a gangster to the president house. So it took that. It took a minister bringing a gang leader to the president house for him to actually fire that woman. But who else he fired? He fired nobody. He fired Daryl Smith, and Anil could tell you why. I ain't getting into that kankalang. But they have something more in the mortar than the pestle. But he fired Daryl Smith. Right? Something personal we hear happen. But I ain't going there. But outside of that, has he fired Terence Dialysis after we now see the significant disaster that was delivered during the COVID pandemic? We were, just the other day, we were listening to, some of you all may have been either listening online or may have been there in person to listen to Dr. Bodoe, to listen to Dr. Rishi Sicharan, to listen to the Honorable Leader Kamala Prasad Bisesa and two other doctors, where they've pulled out the statistics on what happened in the COVID pandemic. And do you know, we had some of the highest deaths per capita in the world. We had the most amount of mismanagement in the world when we heard those statistics. And then you remember the idiot when he comes and says, #1 in the world, total failure. And that man is still the Minister of Health. You imagine over 19 babies die in the hospital, and he's still the Minister of Health. My God, Kamala, Kamala loved children so much. Kamala loved children so much. First of all, she would have opened the children hospital, and those babies would have been in a much different environment and would not have died. And if something like that had happened under Kamala, that Minister of Health would have been fired the next day. The next day. Right? But he's still there. We have a Minister of Sport who is nowhere to be found. When is the last time have you seen our Minister of Sport in anything other than flying, jumping in a plane and flying somewhere to watch Olympics or what, something like that? Where is she? What program is she doing? Sport has collapsed in Trinidad and Tobago. Collapsed. We see the problems with WASA. We see the problems with TNTech today. That minister, Marvin Gaye Gonzalez, right? Total failure. Kamala would have fired him. Rowan Sidanan, every road in this country have a pothole in it today. You have a highway being extended down, heading down south. One little rain the other day, the whole highway under the water. Going through.
We have lakes now, not pothole. We have lakes.
Listen, it have roads with so many potholes. If they get only one more pothole in it, it's smooth. Right? If they get one more pothole, it's smooth. Right? So, Kamala would have fired that man. And I can keep going. You have a Minister of Finance. Oh my good God. Gentlemen, ladies, there's a Minister of Finance cannot account for $3 billion. Comes and says that no, we only have, trying to blame the Auditor General, trying to villainize the Auditor General at $3 billion. And yet we have people in the Privy Council wearing their black suit and their wig, not even listening to the defense of they didn't even have to listen to the defense of the Auditor General. They make a decision one time and send the government packing back to Trinidad, and then come and say that who should be investigated is the Minister of Finance and his ministry. That is who should be investigated. Did Rowley investigate? Did Rowley fire him? Don't know where $3 billion is? And then, most recently, Kamala Prasad Bisesa revealed to the nation a $460 million overspend on an airport wing in Tobago. Right? Now listen to this here, fellas. I'm going to hit you this piece of information now. And when I finish with this, I'm going to have to open the floor for comments and then beg my leave, right? So, listen to this. I came to this country 2 budgets ago and said, why is the government spending $1.2 billion on an airport wing in Tobago, especially when you don't have enough hotels to put the people that are going to be landing in the airport. When you don't have any deals signed with any airlines that would land in the airport, but you spending $1.2 billion on an airport. You're putting the cart before the horse. You building an airport to remain empty and then coming and saying, let me build some hotels. Let me bring some planes into the country and sign some deals. Wouldn't it have made more sense to have had the hotel infrastructure increase in the country? So let people invest, make the deals with the airlines to come in, and as you see the hotel stock increasing, as you see the airlines coming in even more and more, you then justify the spend on expanding your airport. But they come ass backwards, right? And put spend 1.2 billion. And here the mama guy from Colmimbut, he comes in the budget debate, and it's there in the budget debate. He says $800 million for the Tobago airport. Now he said in the budget debate, but what he forgot is that I know that he did not include in that the acquisition of all the land and all the hoardings and infrastructure that was put in there from before. That is what took the price up to $1.2 billion, which was reported in the Guardian, Newsday, and Express. I didn't make it up. And then Kamala Prasad says, exposed to the population that this expense has now gone up to $1.64 billion or so dollars. Imbert comes out and says, no, it's only $16 million US, right? US dollars. It's only 60 million US, man, small thing. And when you check it, we uncovered that lie as well. In one day in the paper, he telling us this much. The next day in the paper, the mark bus, and now you see a next 100-something million come out of nowhere. But you see, in due course, when we get into power, we will investigate, we put an investigation on all of those projects, and we will see the truth. At that point, we'll see the truth, and people will have to answer for the pilfering of money, for the mismanagement of money, for the misappropriation of money. And I want to close this matter, this topic of the airport, on this. Antigua and Barbuda built an international airport, a full international airport with same China came and built it, lent the money and built it. But they came and built an airport, a full international airport, brothers. You know how much for? You know how much for? For $96 million US. $96 million US, they built an international airport that is about double the size of that airport wing built in Tobago today. A full international airport. When the airport in St. Martin was completely destroyed in the hurricane, St. Martin, that has 2 million passengers, tourists coming inside their country a year, 2 million, spent $117 million US, which again is like 700 something million TT for international airport for 2 million passengers to come in. We spending $1.6+ billion, and we only have 370 something thousand passengers coming into Trinidad and Tobago, and plenty of them coming in carnival time. But we building an airport for over $1.6 billion, when 2 other islands that have twice and 3 times and 4 times and 5 times the amount of tourists coming in could build it for half the cost. Half the cost. Big international airport, not a wing. That is the corruption, the racket, the mismanagement that's happening in this country today. And that's why I have to end by saying we must all come together. We must all join together in one unity. It don't matter black, white, Chinese, Christian, Muslim, Hindu, Orisha. It don't matter if you was a PNM before. It don't matter if you're a PEP, a this, a that, whoever he is. whoever you are, we have to come together now to remove the worst government in the history of Trinidad and Tobago, a government that has spent over a government has spent over $600 billion between 2015 and now, and cannot show where over $500 billion has been spent in this country, has nothing to show for it, has a murder rate that is out of control, over 5,000 people dead. Dead, murdered. How much people died in the COVID pandemic? How much people are unemployed today? How much people have been robbed and traumatized? How many people can't afford to buy food today? How many people can't afford to feed their children? How many people can't afford to put their children through school? How many people can't afford to buy a laptop when Kamala gave laptops? How many people cannot see their way in this country today? How many people have exited our shores, jumped in planes and left for greener pastures because they cannot survive in this country? How many people are crying tonight because they've lost a loved one because of this PNM incompetence? And you know who is being impacted the most? Those same people who give PNM a strong mandate in some of those strong PNM areas. Those are the ones that suffering the most today. Everybody's suffering, but those are the ones suffering the most today because the PNM have neglected and they have betrayed their own people. We must come together. We must vote them out. We must remove this scourge. We must never in history again have a prime minister like Keith Christopher Rowley and a cabinet that he has fostered under him, his wing. We must never have anyone like that governing our country in life again. We must rescue our country. Gentlemen, I thank you for the opportunity to say a few words on crime, on the economy, on the state of play, and on the reason why we need to remove the PNM. And I'd like to hand over to you, Gary, to open the floor. I will stay on for a couple more minutes in case there's any questions, and then I'll have to jump out. Gary?
Gentlemen, Senator, can you go ahead with your question? Arjun, Trini? But it seems like, I don't know if I lost connection. Anyway, Senator Damian, I would like to continue when you can come back and we can continue this discussion. There's a lot to be discussed on the national security, and as far as the police and thing, we have a lot of things to say on this. I won't hold you too much tonight because I know you're with family, but I definitely want to bring you back so we could continue this discussion, at another time. So I would like you to enjoy your night. Thank you for taking the time to join us, and we will catch up.
Okay, yes, thanks again, guys. Thanks again.
All right. Trini, you have anything to say?
Yeah, you hear me?
Yes.
Yeah. Thanks for the discourse that you just gave. You touched on a lot of areas that I wanted you to touch on, and that's good. And we have to keep education, the population, like I said earlier to Dr. Bodoe, not just about the flaws and the faults of the PNM. The population already know that they failed us. They failed us miserably, and they know what they're doing, and they never knew what they're doing, and they never had the population or Trinidad and Tobago at heart when they took government. They're not interested in fixing anything in this country. That is why they lost one of their peers to that fire. She could have been saved if they had proper infrastructure. And I know the UNC has been after them, speaking about the fire services. Jayanti spoke about it in Parliament. Dr. MP Tanku spoke about it way back in March, I believe, last year, about the failures in the fire service and the inability of the servicemen, the fire servicemen, to be able to function in their jobs because of lack of equipment and lack of proper facilities to fight fires and equipment in all the fire stations and so on. So you touched on the main areas, but we have to show the population where we will make the changes to make things better. We will make the changes to have the Coast Guard up and running like we did when when the people's party was in government. Thanks, brother.
Well, one of the things I want to see definitely is the Coast Guard cannot 100% be based in Stowboots. The Coast Guard
Correct.
needs to be decentralized. The Coast Guard needs to be placed in Icacos. The Coast Guard needs to be placed in Point Lisas. The Coast Guard needs to be placed in Mayaro. We need to be placed on the other side by the Toko line over there, by Sally Bay and that area up in that. So that Toko lighthouse area, there has to be a response. Definitely those Damian vessels are the most efficient and most beneficial for us to have. We don't need no big warship unless we go into patrol the Caribbean. And I know we have some agreement with the US on that part. But far as in between our borders and country, the Damian vessels seems to be the most efficient vessel to have. We would have a couple of the little interceptors there, like we have in Texas and in the borders up there in Miami and stuff like that. I'm sure you guys have seen the police interceptors. So those are the ones that are much more needed, because you could respond quicker to a fisherman that is in distress with those vessels, and then you bring the bigger one behind. But you need one to spearhead the response, and that is absolutely necessary. So the smaller interceptors, we definitely need to have it spread out. And we have to have a few substations along in the perimeter of the country. We just can't stick everything down in Shadran. That is totally unacceptable. This is the PNM ideology, just for the Spain alone. And it's a lot I mentioned to the boss lady about decentralizing government services to eliminate the traffic and make services. You don't need to spend a whole day running around to get one thing done, and 100 different buildings. So one of the proposals were multi-purpose buildings that you could have various ministries, and we have to decentralize those things. We covered the health center issues and the health thing with Dr. Bodoe earlier. So definitely, Senator Damian, I want you to enjoy your night. I know we set up your blood pressure. We set up your blood pressure.
No. Hey, listen, gentlemen. Let me tell you something. I made a sacrifice 5 years ago. I made a life sacrifice 5 years ago. It was a decision I had to take with my family. It was a decision I took for my country, and I think that I feel very proud to be one of the 6 senators, and a team of United National Congress front runners as MPs and senators. I feel proud to be a part of this team, because I think anyone should feel proud when they serve their country. Anyone should feel proud when they are holding a draconian and corrupt government to account, because what we're doing it for love of country. We are doing it for the citizens of this country. I took a sacrifice 5 years ago to do this. I have ran the entire course. We are almost an election. Whether I am in the election or not matters not to me. What matters to me is I've served my country for.
You're still in the fight.
I've served my. Sorry.
Yeah.
I've stood in the fight.
Whether you're in the election or not.
Yeah, whether I'm a candidate in the election or not, whether I'm chosen by the leader or not, it matters not. I am a loyal member to the UNC. I am loyal to Kamala Prasad-Bissessa. I'm loyal to our team. I'm loyal to our country. And I will finish the fight of the 12th Parliament. As we come to the close of the 12th Parliament, I will finish that fight on a high. I will keep it going. I feel proud, and that's why I'm always happy to take part in these type of programs, which gives us an outlet to really speak the truth and speak facts to people of Trinidad and Tobago who otherwise would not hear the entire truth and the entire facts through some of our media houses who have been bought out by the PNM. I'm not calling any names, right? I think Kamala did a good job.
Well, we clearly see that, and that's why I'm making this effort. Yeah.
I think Kamala
that's why I'm making this effort.
I think that the boss lady did a very good job in itemizing exactly who is the perpetrator of that, right? And I leave it at that, right? She said enough, and I leave it at that. And all I say is, it is through these type of programs that we are able to really get out to people, speak to people, and that is how we've been getting the message across. So once again, gentlemen, I thank you very much for having me on this evening. I stayed longer than I thought I was going to stay, but that is always because Gary, Trini, you fellas love the country, love the party, love want to fix Trinidad and Tobago just as much as we want to. So even if you're not in the Senate, even if you're not in the lower house, you're still a fighting member of our party. You're activists, you are fighters, and you are doing it for the love of your country to see that we bring Trinidad back to what it used to be when milk and honey flowed in this country under Kamala Persad-Bissessar. I mean, it even flowed somewhat under Manning too, eh? So it took a special failure in this Prime Minister and his cabinet to completely destroy everything that even his Manning Prime Minister and our Prime Minister Kamala Persad-Bissessar built over the decades. He mashed up everything. So all of us,
they're making it rich richer.
All of us are in this fight for love of country. So I feel very grateful to be in this program with you all tonight. I thank you all, and I hope you all enjoy the rest of your Thursday evening. And I'll be more than happy to join you on the program again, Gary. You know, I'm a phone call away for you.
As soon as you're available, I will be in touch. As soon as you're available,
you're always a WhatsApp message and phone call away from me, right?
Right. So thank you very much, and have a good Christmas. Enjoy yourself.
You all too. Merry Christmas and happy. And I'll probably see some of you all in the UNC event coming up on the 27th. Anyway, take care. All the best, guys.
Good night, brother. Thank you. And I want to thank all those who joined us tonight, our listening audience. And we will continue this journey to educate and inform our people and bring our people together. This is our fight, whether you're inside or outside the TNT. The objective is to bring everyone to have a say-so in building our country. Those that are professionals outside the country, I want to be able to engage you to participate in this fight and upgrading TNT. I know a lot of you were rejected. Your ideas were rejected. This, as you came forward to help your country. But this is the platform to bring all of us together. So with that, I will say good night. Trini, you want to say anything else before you go?
No, man. It's good. I passed my bedtime.
Yeah, right. Yeah. So tomorrow we be broadcasting MP Charan Toy Drive and MP Munilal Toy Christmas treat over there in his constituency. So that would say good night. Thank you very much, everyone. Good night.